City Council is now in session. Please stand for the invocation by Vice Mayor Bennett and the Pledge of Allegiance to the flag.
Let us pray. Father, we come again to say thank you for another day. We ask you to bless each and every one that's assembled. As we go through the process of the citizen business, Father, we ask you to just bless us in a mighty special way and be respectful, and whatever we do will be pleasing unto you. These things we ask in your Son's name.
Pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Madam Clerk, please call the roll.
Councilmember Fawcett.
Here.
Councilmember Goldberg.
Here.
Councilmember Johnson.
Here.
Councilmember Ward.
Here.
Councilmember Williams.
Here.
Vice Mayor Bennett.
Here.
Mayor Duman.
Here. The Freedom of Information Act certification is required at this time. Madam Clerk, please present the resolution for consideration.
A resolution certifying the closed meeting of February the 3rd, 2021 pursuant to Virginia Code Section 2.2-3712. Now therefore be it resolved that the City Council of the City of Suffolk hereby certifies that to the best of each member's knowledge, only public business matters lawfully exempted from the open meeting requirements of Virginia law, and only such public business matters were identified in the motion convening the closed meeting were heard, discussed, or considered by the City Council of the City of Suffolk in the closed meeting. The resolution is presented for Council's consideration at this time.
Motion is in order. Vice Mayor?
Move for approval.
Have a second. Councilman Goldberg. Madam Clerk, please call the roll.
Councilmember Fawcett.
Yes.
Councilmember Goldberg.
Yes.
Councilmember Johnson.
Yes.
Councilmember Ward.
Yes.
Councilmember Williams.
Yes.
Vice Mayor Bennett.
Yes.
Mayor Duman.
Yes.
The motion is approved by a vote of 7-0.
Approval of the minutes from the September 3rd, 2020 work session and regular meeting is the next item for consideration. Motion is in order.
So moved.
Got a motion by Councilman Fawcett, a second by Councilman Ward. Madam Clerk?
Councilmember Fawcett.
Yes.
Councilmember Goldberg.
Yes.
Councilmember Johnson.
Yes.
Councilmember Ward.
Yes.
Councilmember Williams.
Yes.
Vice Mayor Bennett.
Yes.
Mayor Duman.
Yes.
The motion is approved by a vote of 7-0.
Okay, before we move to special presentations, Mr. City Manager, I understand there's an additional item to add to tonight's agenda.
Yes, Mayor, Vice Mayor, members of City Council. Staff received information this week concerning a new broadband initiative, which we desire to share with the City Council this evening. At this time, it would be appropriate for a motion to amend the agenda to add item C under special presentations called Broadband Initiatives Update. Motion would be necessary.
Thank you, Mr. Manager. Motion's in order. Councilman Johnson, the second by Councilman Williams. Madam Clerk, please call the roll.
Councilmember Fawcett.
Yes.
Councilmember Goldberg.
Yes.
Councilmember Johnson.
Yes, I'm sorry.
Councilmember Ward.
Yes.
Councilmember Williams.
Yes.
Vice Mayor Bennett.
Yes.
Mayor Duman.
Yes.
The motion is approved by a vote of 7-0.
We'll now move to special presentations, and our first presentation is concerning COVID-19 vaccination update. Mr. Manager, please present an overview.
Yes, sir. Mayor, Vice Mayor, members of council. The Suffolk Health Department and the city staff continues to work together to improve efforts in meeting the needs of our citizens during this pandemic. Tonight's COVID-19 update is to be a two-part presentation given by Dr. Lauren James, Interim Director of the Western Tidewater Health District, and followed by Deputy Chief Spicer. At this time, I would like to call Dr. James to the podium for the initial part of the presentation. Thank you.
Good evening, Honorable Mayor and Honorable Council members. So I will be doing the COVID update this evening. First slide, please. All right, so this is our pandemic dashboard. So I'm just going to start with the overview of what COVID numbers look like in our district. We have about 75 new cases a day on average. Our percent positivity is 17% at this time, and the state percent positivity is 11%, and that reflects the amount of positive tests out of all the testing. And the next metric shows outbreaks. So our outbreaks are steady, so that is good. And the last metric reflects cases in our healthcare workers, which is also decreasing. So that's a metric that we look at to make sure that our staff that are working in long-term care facilities, hospitals, nurses, things like that, are in good condition, because in the event of a continued surge, we want to know that their cases are under control. All right, next slide, please. Now that our vaccines are here, what are we using? The U.S. currently has 2 vaccines that have been approved through the EUA approval, that is Emergency Usage Authorization. Those are Pfizer and Moderna. Our district is using Moderna. It is mRNA-based, 2 doses, 28 days apart. It does not require specialty equipment for storage. Pfizer, also an equal and just as effective vaccine, does require the ultra-cold freezers. These have been on back order since December, but we are working to get some and hope to be able to acquire some in the next month, if not this month. Next slide, please. I think I went over this slide last time, but it's always good to cover. Why are we pushing vaccination? Vaccinations are our best tool to fighting disease and illness. Vaccines reduce the number of susceptible individuals in the population, prevents morbidity and mortality due to illness, reduces transmission through herd immunity. So what is herd immunity? Herd immunity is when we achieve immunization of 1/3 of the population. So let's say our community is 100,000 people. That would be 33,000 people. So that is our goal, to eventually get 1/3 of the community vaccinated. Next slide, please. All right, Health Department services. So last March, in an effort to keep citizens safer, we transitioned some staff to telework, but the majority of our staff have continued to work on site. The Health Department did stop in-person appointments at that time, similar to other facilities in the Eastern region. The Health Department will be resuming 1 day per week in-person services at the Suffolk Health Department this month. Before COVID, we only offered 2 days a week at the Suffolk site. Since this is a district that contains 4 localities, we actually have 1 nurse practitioner that covers all 4 of these districts. That is what the funding supports. So we are doing our best. We will be providing a weekly vaccination event targeted to vulnerable populations, specifically our seniors, which we have seen have been the hardest impacted by COVID. First event was last Friday. We vaccinated 120 seniors. All of our departments, WIC, environmental health, and nursing, are still and have been accessible. Next slide, please. City distribution plan. Allocations are determined by the state, not the district. Recently, they changed to a population-based allocation. The Western Tidewater Health District is about 2% of the Virginia population, and the Suffolk Health District is about 1.2% of the Virginia population. Group 1A, what does that include? That was our first group that we started with, December 28th. Those were our healthcare providers and long-term care facility residents and staff. January 20th, around that week, we made a press release saying that we were moving into Group 1B. What does that include? Our frontline staff, police, corrections, daycares, schools, food and agriculture, manufacturing, grocery store staff, public transit workers, mail carriers, city officials, citizens 16 to 64 with major chronic illness, and 65 and up. A recent statement today was shared that in Virginia, Group 1B is 60% of the population. So this is a large, large group, and it will take months across the state to move through this group. So who can vaccinate? Who are our partners? Hospitals, health departments, pharmacies, local providers. I will share that Suffolk also partners with community providers and pharmacies so that they can distribute. Something we've seen with our seniors is that those who aren't as mobile feel more comfortable getting it in their pharmacies and with local providers, and that could be with anyone. So we do try to make sure they have allocations when available as well. And so, as I stated, the Suffolk Health Department will have a weekly vaccination event that does target seniors, and once our allocations are increased, we will be able to do more. The plans are in place, so we are in a good position, and as soon as we get more, we will do more. Next slide, please. What's next? At the end of the month, we will be moving to a new registration tool. So this is a BDH mandate, just to keep us all united. It is a better tool, it is easier accessible, but it has created a delay in how the public can register because this transition has just kind of created a kink in the system. But we are working through that. Communication plan, we do see this as a major point of improvement on our part. We are aware that the public, needs better access to us. And in that same vein, we are working on updating our website. We do not have anyone on staff for our health department who does IT, but we have reached out to our central office and they are supporting us. We plan to update our website to have more relevant and helpful information. We are working on that currently. Also, within communication, the City of Suffolk is supporting us to have a call center where our citizens can call in and get information and resources. I know on some local sites, there is a survey link. And most health departments who have this survey link, this is just collecting information. It is not a way to access an appointment. We call it a pre-registration pool. So what these links do is collect their information and put them on a waiting list. So that can be an option for our website as well, or we can continue to have people schedule through the hotline. So once allocations increase statewide, we're gonna ramp up our services and be able to do more. This is a marathon, not a sprint. All right, next slide, please. So this is just the last slide. This is just overviewing. We're currently in phase 1 of our vaccination, so that is where we focus on our priority groups, our most vulnerable citizens and our frontline care workers. And if you see in red, that's where we are now. Our vaccinations are limited because we don't have that many in production. But we hope to eventually move to phase 2, where we have more available. And then the last phase is phase 3, where the COVID vaccine is just like our flu vaccines. They're at your primary care, they're at your urgent care, they're at the tip of your fingers. So we really hope to be in phase 3 by the summer. That's being optimistic. But that is all I have, and I will take any questions.
Councilman Johnson?
My question is real easy, Dr. Jane. Thank you for being here, by the way. I want a phone number. I had two 80-year-olds call me today and said, how can we get in line to get, this is true. And I couldn't really tell them because they said they tried the phone number over and over. Is there any way, particularly people that aren't computer savvy, oh, that's wonderful, but these older people need a phone number. And then to be told, when are the lines going to open back up?
So we are working with the city on a hotline. And the health department call center it's not a call center, their line is open, the Suffolk Health Department.
What's that number?
I don't know.
Oh, I'm sorry.
I'm sorry, I don't know.
I thought there was a magic number.
No, sir.
The number that's over there is 514-4781. 514-4781. I have it memorized.
Excellent.
But, to let those citizens know that it might be a wait, so I'll give an example. I'm pretty sure the clinic we had last week for seniors, if that's the citizens that we were talking about,
right.
They were able to call and make those appointments, but it's only 120 appointments.
Right.
So as soon as those open up, we'll be able to do
But you have another one coming up this Friday, the same,
Yes,
same 120? And then, when can they start? The next one will be when, maybe?
I think it's going to be every Friday. Is that what
Okay, is that what it's going to be?
So I would, say the day before.
And what would you advise these people that are calling and not getting through? Just to keep calling?
Yeah, and
Sadly.
be patient with us because it's tens of thousands of people waiting.
Yeah. How about, the other question I had was pharmacy-wise. Do you know what pharmacies in Suffolk? I know, one of the pharmacies is doing it, but they're not doing it in Suffolk.
Oh, I think it's, I would say they should check with whatever pharmacy they are usually getting their medications from.
Right.
But to my knowledge, we are planned to partner with CVS, Harris Teeter, and what's the other one? I'm missing somebody.
Rite Aid or Walgreens?
Walmart. But the issue is they have to vaccinate their own staff first, and then they're going to offer it to the public. So wherever they pick up their medicines, because that might be more comfortable. And there's several practices that we're partnering. Bayview.
Bayview's doing it.
I know Bayview's doing a lot.
Is Centera yet?
So I do think Centera Norfolk General, but I haven't heard of like overseeing our Centeras in Suffolk doing like a mass vaccination. I haven't heard of that yet.
The population is just desperate for information. That's what, and we're all running into the same thing. But thank you. We appreciate, and we know it's a huge undertaking, but quicker. We need quick. Thank you. Thank you.
All right. Yes, sir.
Thank you. Thank you, Dr. James, for your presentation. And I know that you came into Suffolk at a bad time, and I admire you and thank you for doing that. I think Suffolk has sort of dropped the ball where they should have had a deputy system person, doctor, but you are trying to cover such a large area, and I know you're only one person, and you only can put out the number of shots that you receive for the localities. So I feel sorry for you with all the pressure
Thank you
that
for
you are
your
getting.
empathy. Thank you.
Because I know what it's like, because we are getting it as well as far as calls, and I know you're getting it a whole lot more. But I feel sorry for you with the amount of responsibility that you have to cover. And so do you have any way of knowing yet whether or not we will have drive-in where people, the seniors or people can come without appointments?
I will say that Suffolk is in a good position, and as soon as we get in, I'm very optimistic that the allocations have to improve. So we've just maximized our distribution. So if you look at one site, the VDH site said that Suffolk's already done 6,855 vaccinations. That's a good number based on our population. That's not even the whole district. But to your point, once the state is giving us more, those plans are already in place to make it more accessible, and whether that's at, a community site or drive-in, they already have a good amount of plans for those.
The other thing, isn't it true that the state is giving the vaccines out according to the population? Is that true?
Yes.
So therefore, where did that make Suffolk fall in the line with?
So 1%, so the more density you have in population, the more you'll get. And out of the 1.2% we get for Suffolk, we try to, as much as possible, distribute it to get to vulnerable populations, and then as well as that 1B, the group that I listed. So we try to kind of split it as much as possible between the two.
Last comment, and I know, Mayor, I'm taking a lot of time with this one, but
all night.
on the senior population and the African-American population, look like their numbers are down, way down with the number that's being able to get the vaccination. Because I have a lot of African-Americans that's calling me saying, we can't get it, we can't get it, we can't get it. So I'm just trying to figure out how we can get more in our neighborhoods that people actually have problem getting online or trying to get the shot, get the vaccine. So
I think, just one solution, that's not the only solution, but as we are able to partner with churches in the community, so maybe the health department isn't as easily, well, I guess it's not super accessible by phone right now, but, we have to have other venues. I think that's what you're saying, to reach all ethnic groups.
Right.
Because that's a vulnerable population as well as far as deaths of COVID. So I appreciate your point, and we'll include that in our plans. Thank you.
And thank you again for being so patient.
Goldberg?
Mr. Mayor, just to deviate a little bit from this, I'm not here to embarrass you at all, Ms. James, Dr. James, is that her father and I have been friends for many, many years, and I remember when she was born, and she has been just a delight, and I'm so glad. I didn't know this until tonight, and I'm so proud of you, because I remember when you were born, and you've become this doctor and a big help to the community, so I thank you for it and appreciate you doing that, and give your parents my best, please.
Yes, thank you for your presentation. Like you said, you made a statement, said when you get the next batch, are you already contacted churches or places that we can get it going kind of fast?
So we are in contact with a community and church site. but we really want to open it up once we can fill appointments. So our planner is working hard, and once we have the vaccine secured, he's gonna open it up to the community, and so it'll be on our website, and we'll let people know how they can register.
And like you said, I don't know how much your help you have. Maybe you can get some volunteers to help you out with the next batch or something, because you got one person doing one thing. I mean, it's an overload.
Well, Suffolk's actually in a good position. Through the OPAC Grant Foundation, we were actually able to hire a vaccine planner that's specific to these efforts. So that's going to take a lot off of the plate of our main emergency planner, Will Drury, who has been doing a great job. But as we know, anybody who has backup, they're going to do a little bit better and a little bit more. So we're in a good place with that.
Okay, and I want to ask you another question, because I wanted to ask that question last time you was here. I don't see anything about, like, people who have cerebral palsy or all that. Are they getting shots early, or where they line up at? People that have mental health or anything like that?
So behavioral people, mental health, that's the easier one. So group homes and those in behavioral health centers, they are in the 1B group, and we have received a list. And some of those are being done. There's a federal, what's it called, a federal pharmacy partnership, where they will be vaccinating, and then whatever the pharmacies can't do, the health department will pick it up. So that's one part of the question. And with cerebral palsy, that would just depend on how severe it is. So if it's someone who's in a facility, like a nursing home facility, they would have been vaccinated in the first group.
Yeah, because a lot of them can't communicate with you.
Right, so if
stuff
someone
like-
can send it for them, they would have been vaccinated in the nursing home population, or
thank-
assisted living, sorry.
All right, thank you.
Councilman Fawcett.
Thank you, Mayor. Dr. James, I appreciate you being here tonight. It's always a pleasure to have you in Suffolk. This vaccine supply is not unique to just Suffolk. You see it and you hear it. It's kind of all over the countryside and all over the state. So I think that, as the vaccines become more available, maybe another one comes online. I think Johnson & Johnson's relatively close. That could help facilitate getting more people vaccinated. There's been a lot of, pushback on some people that won't take the vaccine, and that's all well and good. That's their decision. But I would hope that many people would take it. I've known 3 personal friends this week that have passed from COVID-19, which is not great. I mean, and it's happening not just to me, but to a lot of families each week. We had one of our family members passed yesterday. So we're looking at this as well. So I want to thank and tell you that William Drury is just phenomenal. I mean, he is phenomenal. He's working day and night to try to get people. I mean, he's taking this vaccine stuff real serious. I mean, he is out there and he's doing some oil burning late hours trying to get things lined up for the next day and get the the total amounts that they can get. And I mean, he's pushing it hard. He was on Channel 10 last night giving a little briefing on some of the differences in the Western Tidewater Regional Health District, what we've been faced with, and did a great job with that. So with that, we'll just keep pushing, and hopefully we can get the numbers up even more so for those that want it. And they'll just have to make that choice. But I'm not sure how that works. A choice between life or not being here could be a difference. But I thank you for being here.
Sorry for your loss.
Thank you, Doctor. I'm sorry. I'm sorry, Councilman. You gotta get that hand up. I can't, little short guys can't see down there for it.
Thank you, Dr. James, for excellent presentation. I just have one question. I understand that other areas in the Hampton Roads are utilizing the school nurses to help facilitate the deployment of the vaccine. Is that a practice that we'll be doing in the Suffolk area, or is that?
So we can look into that, but currently we are using the MRC, and Suffolk has about 200 MRC and a large amount of vaccinators. And, because of our I think, great mayor, he's calling people to continue to join, and we've actually seen a steady stream of people reaching out to volunteer to be a part of this effort. But I do think that's something we can look into as well. We're not above anybody's helping as long as they've got a certification. So that is a good point that we can add when we're looking at additional resources. Thank you.
Thank you, Dr. James. I appreciate you coming and giving us your presentation. I've got a few comments, and they're absolutely not directed at you. You're just going to be the messenger, because that's what I'm going to be. I'm going to be the messenger. I'm going to tell you briefly the daily communication that I have, with my constituents in regards to vaccines and COVID-19 in general. To start with, I think to sum it up, our citizens are, for the most part, they're starving for information, literally starving for information. 95% of the citizens I have spoken to, they are not upset that they cannot get a vaccination today. They know that there are circumstances beyond your control and the health department's control. We start with the feds, we come to the states have to get it to the localities have to get it to your organization, and then it has to be dispersed. This was recognized. The Hampton Roads Planning District Commission sent a letter to the governor on January 21st. And the first paragraph in it kind of sums it up. It says, "It is clear that each health district is approaching this effort in an inconsistent manner, which is causing confusion and frustration across our region. While we understand operational flexibility, this approach, where each health district establishes its own policies, is not serving our community well." And that's exactly what it is. We know you have limited resources. The problem we run into is most individuals can't go to a website and get information. I called the local health department this morning just to double check, because I knew we had a meeting tonight, so at 8:15 this morning I called and see what the new recording was. The new recording was the same recording from yesterday, the day before yesterday, the day before that, and the day before that. We don't have any more vaccines. Well, I said we won't have any more vaccines for 2 weeks, so that gives you an idea when the recording was done. It says to call back February 4th. Well, that's tomorrow. So that recording's been on there for quite some time. Our citizens need to know more than that. That answering machine, in my feeble opinion, needs to have alternate ways of communication, being it Franklin's number, Isle of Wight's number, Southampton's number, all facilities within your district. It needs to have a daily update to keep our citizens informed, so they're not sending me, "This is the number of emails I got today, not counting the phone calls." And like I said, I'm not fussing at you, because I know you got limited resources. While I see other counties and municipalities having active websites, web dashboards, finally rolling out active engagement communities they serve, the Suffolk Health Department has a phone number. That's it, and it says do not call until February 4th. Something's obviously wrong. When I called the health department, no one answered, and it states that they're closed. And could you please take action to improve the current Suffolk vaccine appointment process so that it is more effective, fair, and less cumbersome? I wanted to express concern and frustration over the manner in which communication regarding the COVID vaccine is being provided within Western Tidewater District. And I just want you to relay this information. Anybody who wants to talk to me, I will spend as much time to talk about it as we can. I can't seem to find any information on when or where to get the vaccine. Frustration isn't a good enough word for the lack of a better way to help control the spread of the COVID-19 virus. And, I've got 10 more. And nobody is upset because they cannot get vaccinated today. We have to find a way to disseminate information in a more effective manner. I've spoken to the city manager. We will offer any possible assets and resources we have to assist you in doing that, be it personnel. We can help you with a call center. We can help you vaccinate people. We can advertise for you to get that information out. We could do traffic control if you want to do a drive-through. I have had numerous phone calls from churches and civic leagues. We've got more locations. We could vaccinate 2,000 people tomorrow, because I've got churches throughout the city. I have communities, civic leagues that have called me and say, "I will offer my facility." I have spoken to Delegate Jenkins, and last week. I've spoken to them on several occasions. I've got an email here that was sent to me on the 3rd. When I contacted Delegate Jenkins' office this afternoon, they told me the problem with Suffolk Public Health Department has been closed. And since it was closed, the potential is that our shots went elsewhere, better prepared to give vaccines. Now, that may not be the case, but this is the email, and that's what I got today. So, if nothing else, please inform Delegate Jenkins' office that that is not the case. It also said here that it reached out to the mayors. We as a city, with the help of the city manager and the staff and everybody here, is willing to do what we need to do. But there has to be information out. People just want to know what to expect. I've got more of my friends that went to North Carolina to get vaccines that live here. And they showed up in North Carolina, got in line, put their arm out the window and got a vaccine. And once again, I am not directing this. I know it sounds like I'm fussing at you. I am not. I want you to be the messenger. And you let us know what we need to do as an administration and everybody up here on this dais to better serve our citizens. So with that, like I said, I apologize for doing it, but this has been going on for a while, and hopefully tomorrow morning I'll have that many emails sitting for me to respond to, and I try to respond to every single one of them. So I do appreciate you coming tonight, and I know that you have a terrible load on your shoulders, but anything that we can do to help, we're here to help, and please relay that information to whoever's above to let them know that we have a problem. Thank you. Mr. City Manager.
Yeah, first of all, I'd like to thank Dr. James. She's been very attainable for me, as we call her. But I would like to bring Brian Spicer up to talk about what our efforts have been to date.
Mayor, Vice Mayor, members of council, it's good to see everyone this evening. I'm going to give you just a little bit of a brief update with, I think, a little bit of a spin for the city of Suffolk this evening. Some of this might be a little redundant to what Dr. James just covered, and I apologize for that. But as you all are aware, we're still dealing with the 3 phases here, 1A, 1B, and 1C, and we are into the 1B phase at this time. Again, we talked about this before. Phase 1A was all of the Suffolk Fire and Rescue personnel, and all of those first doses are complete, and the second doses are set to begin tomorrow, the day after tomorrow, and the day following that. And with that, we should be complete with all of the paramedics and firefighters in the city. The 1B, with respect to the city and school employees, it's my understanding that 993 school employees have been vaccinated. 49 vaccinations of City of Suffolk employees or school system employees took place at the Workforce Development Center in Franklin, and some 31 took place at the Smithfield Center, with 225 vaccinations taking place at the Benton Road facility that we had, I think it was last week. Now, these numbers, according to the health department, might be slightly underreported, as they had to search for this information and this data via the employee's email address, the City of Suffolk. And it also does not include court employees here in the City of Suffolk that we included with our city personnel. So these numbers would be just a little bit higher if we had a true actual count. 1B vaccinations in Western Tidewater Health District, I believe Dr. James mentioned this earlier, some 6,000 doses with over 800 fully vaccinated in Suffolk. 825 doses in Franklin with 74 fully vaccinated. Southampton County, 1,111 and 54 fully vaccinated. And Isle of Wight, 2,815 doses with 283 fully vaccinated. Also helping us out, to our surprise, in a good way, Centera reached out to us about a week ago and offered to vaccinate all of our law enforcement officers in both the Suffolk Police Department and the Suffolk Sheriff's Department. As the timing had it, there were only about 55 law enforcement officers that time who had not acquired or wanted the vaccine and acquired it through our planning with the health department. So to the best of my knowledge, these 55 are being taken care of now through the gracious offer through Centera. So we greatly appreciate that from Centera. And I believe that was the OBC site. So Vaccine supply is, I want to say, the biggest issue we're dealing with here, but I'm kind of beginning to think that vaccine supply and information flow are competing to be the biggest factor that we're dealing with here. When I put this presentation together, we were slated to receive 800 doses for Western Tidewater, and about 500 of those were set to come to Suffolk. Again, since I put this together, I believe that number has increased to, I believe it's 1,700 doses for Western Tidewater Health District. And the latest information is there's no expected increase in supply for the next 4 to 5 weeks. And Dr. James, if I got that wrong, please let me know. Again, public information is critical here with what we've got going on. I think everybody would agree to that. We are continuing to coordinate at least daily, sometimes 2 or 3 times a day with Western Tidewater Health District. Will and I have one another on speed dial to talk about these issues. I have the City of Suffolk's Emergency Operations Center's call center. I set that up last week. That is physically up and ready to go. Once the health department says they're ready and brings in a little bit of staff with some people with the knowledge of what to say on it, we are ready to go with that. Media and Community Relations Department continues to share information from the Health Department. I think they're doing a great job getting the message out there as best they can. We are participating in weekly calls with Delegate Jenkins for, I guess he's calling it like a coordination type of call or a communication call to share information amongst key players. And recently the governor has issued a directive to activate a statewide call center. And other than that being directed, I don't have any additional information on that at this time. Suffolk Fire and Rescue providing vaccinations. Last time I was before you, I talked about our paramedics being vaccine providers. We have completed the VIIS vaccine information system through the state to be able to acquire vaccine through the VTREX system. We have completed the training for our paramedics to administer the vaccine. We have an MOU in process with Western Tidewater Health District that I expect may be executed within the end of this week, perhaps, if I'm not being too aggressive on that. And we simply need the VDH nurse manager to sign off on us, and we should be good to go to assist with providing vaccine. Clinics that are out there, I don't have a full list of all the clinics that are currently out there. They're established, Western Tidewater Health District is establishing clinics and only scheduling second dose vaccinations at this time due to the limit on vaccines. All first case doses have been canceled with the directive to call back February the 4th. Bayview Physicians is administering, I think this is independent of the health department, but they are administering vaccine to their patients by age and by appointment. They are reaching out to their patients by email, and they're noting that their clinics are full within about an hour of announcing one. Walgreens is administering vaccines. They are part of, I think, I heard Dr. James mention the federal partnership to administer vaccine. So they're doing so to all the long-term care facilities. They are visiting each of these facilities 3 times. They have administered some 6,500 vaccines in those facilities, and they expect to complete all long-term care facilities by mid-February. You also have physicians' offices out there that are offering vaccine. It's my understanding that the Department of Defense for people in the military can seek vaccines through their command. The Department of Veterans Affairs, if I understand correctly, is also offering vaccines for veterans. So if we have any veterans out there, get a hold of your Veterans Affairs and see if there's an opportunity there to receive a vaccine. Going forward, we're going to continue to coordinate with and assist the Virginia Department of Health and Western Tidewater Health District. We're providing information to our employees and the public as we receive it, developing and managing vaccine sites as they become available, and assist with providing vaccine upon that approval from Western Tidewater Health District for our paramedics. And with that, our reminder to wear your mask, social distance, and to wash hands. And I'll be happy to answer any questions that you may have for me.
Councilman Fawcett.
Mayor, if I may add 2 points prior to that. One thing is positive that's going on in Richmond is Senate Bill 1445, and there's a company House bill that allow our medics and other qualified persons to start assisting without automatically if they have the proper training, and that should be in crossover, coming to crossover shortly, so that'll allow a more proactive approach of using other staff to administer the vaccines once the flow of dosages increases. I think the capacity to administer doses is there. It's just the flow of the doses to getting here to administer. Also, one thing when we report the 6,000, that's coming off the health department's database, I believe.
I believe that's, yes, sir.
What we're missing here, and we had our regional call of all the city managers, our monthly call today, and one thing where we're trying to do is find out, we have a big military presence that's being vaccinated through the federal government. So we don't have that count. And it would be good to know whether our population base in that area, the vaccination rate on that is, because that'll start driving some other questions or helping answer some other questions on how many, what we should anticipate, and that type of thing. And with that, I'm sorry for interrupting.
Councilman Fawcett.
Thanks, Chief, for coming out tonight and giving us some information. The one thing that I cannot get my head wrapped around in this is paramedics. I know the paramedic program frontwards and backwards,
Yes, sir.
and we go through extensive training to be able to administer on a day-to-day basis in the street drugs of every kind and fluids of every kind. And what blows my mind is that we're going through all this information to be able to administer whatever the CC drug's going to be, of Moderna or Pfizer, which doesn't even weigh into the amount of what we produce when we make a medical call in the roadway. And we're going through all of this MOU and all this process that to me is just mind-blowing, that we have paramedics that are licensed to administer. And yet we're going through this hoop jumping in the state. By the time we get these guys hoop jumped, maybe we'll have enough vaccines to get them in and there'll be more of a value to us. But this is absurd. This is mind-blowing because this shouldn't even have to happen. Our OMD should be able to hop on this and move this thing forward like a blink of an eye. And it's crazy. And I just want to say that I don't know why we're having to do this, and maybe there's a better explanation than I know, but being in the field that I was in, I just don't understand this. This is, I've never seen and run into this issue before. So anyway, I wanted to put my 2 cents on that. And yes, the DOT is ramped up. The Naval Hospital for DOT employees and military have done a plethora amount of vaccines in the last couple of weeks. Most of the commands are either directing you to one of a few of the facilities to get vaccinated. I have known people that are taking advantage of it. That DOT civilians also, not just the military side. And I have been told by some of my other colleagues that are vets that they are doing it at the VA hospital also. You just got to go through the hoops to get on, and they got a scheduled time for shots, so it's not, they haven't had a problem over there. Not to say they won't, but they seem to be doing pretty good. So just continue to do what you can. I really wish we could not have to go through all this red tape, political, whatever it is that's causing us to bog this down, but this is absolutely crazy. Crazy. And I think you would understand why I'm saying what I'm saying.
Yes, sir, I agree. I agree 100%. It is frustrating. Our operational medical director, he's been on board with what we're trying to do from the beginning, and he's written his letter in support of that and approved the paramedics that we have selected to do this.
Paramedic can't even do anything until the OMD clears them to start with. And they've been cleared once to do, I'm not going to go into all the drugs they can administer and all the fluids they push, but I know what they are. And it seems to me that weighs heavily different from what this COVID thing is. I think it's being overkill when it comes to our paramedics.
I think if this had been a new drug that came through the region and through our regional drug boxes, there might be a different approach to it. But given that it's a one-off and it's not part of our regional drugs that we do administer, I guess there's, boxes to check, and we're trying to check all those boxes.
I got you. I thank you for doing what you're doing,
Yes, sir, thank you.
and all the personnel that
Questions or comments from Chief? Councilman Ward?
Do you have an idea how much supplies they will send in this area, in the region or the city? What totals are?
I'm sorry,
How much for supply of the vaccine they will send on the next shipment,
Again, what I mentioned earlier, that when I put this presentation together, I think we had 800 doses that were set for us, and if I understand Will correctly, that has been increased to, I think, about 1,700 doses for this upcoming week. So 1,700 doses amongst the Western Tidewater Health District, and then they will break that out on a percentage basis for the population. So with the 800 doses we had last week, Suffolk, I believe, received around 500 doses. Now, remember, that's just to the health department. There are other entities, I think doctors' offices, the pharmacies and whatnot, that are acquiring vaccines, Centera, that I don't believe that are going through the health department. I think that they are receiving vaccine through I think it's called the VTREX, or through the central office. So this is what the health department is reporting, that 1,700 that we should expect for next week.
Is that going to increase? I mean, just 1,700 and people asking, I'm getting calls too. People asking everywhere where they can pick it up at. That's all. That's not a lot.
I think that it will increase.
Okay.
The question is when. And
Right, that's what I'm saying.
The health department is saying, with the 800 dose number, they were telling me not to really expect an increase for, I think it was 4 to 5 weeks.
You know what I'm saying? 4 to 5 weeks.
Yes, sir. So I think eventually something's going to break loose here, and then the vaccine's going to start flowing, and then, our bigger problem won't be that. It'll be, where to go give it and get that all squared away.
Thank you.
Yes, sir.
Other questions, comments from council? Chief Spicer? Excuse me, I have one question for you. I meant to ask Dr. James before she left. Our regional jail, the Western Tidewater Regional Jail, they have very few of their officers that have been able to be vaccinated. Can you arrange for a clinic? They can actually administer their own vaccines because they have medical staff, but the superintendent's been unable to obtain vaccines, and obviously the jails have been, significant, factor in a lot of those COVID-19 cases. So how can you help me there?
I'm not sure yet. I just actually learned that today. Early on, when the vaccine started trickling out, I was told not to worry about the jails because they were going to be registered as another department under another system. So to be quite frank with you, I, up until today, wasn't even worried about the jail because I thought they were taken care of. I just learned what you told me. I had just heard that for the first time today. So I'll certainly put that on my radar of things that we need to address and see what we can do to help them out.
Please do. And when you find out, if you can get in touch with the city manager and he can inform me, and I in turn can speak to the superintendent and let him know what he may or may not be able to expect. But thank you very much for your presentation.
Yes, sir. Thank you.
Okay, our next special presentation will be concerning Broadband initiative.
Yes,
Mr.
Mayor,
City
Vice
Manager.
Mayor, City Council, staff continues to explore all avenues to expand and enhance delivery of broadband services to our residents, specifically unserved residents. And tonight's presentation will provide City Council an overview of a new initiative, which staff and I just found out about early this week. At this time, I'd like to call Randa Gaitan, Senior Administrative Analyst, to the podium. Randa's been working on our VATI grant and has been close to a lot of our broadband initiatives over the last year. And I'd like for her to give the presentation this evening. Looks like she's having a little technical problem.
Good evening, Mayor Duman, Vice Mayor Bennett, members of council, and city manager. Tonight, I'm going to present to you all an update on the City of Suffolk's current broadband initiatives, as well as an exciting upcoming broadband funding initiative that we've been recently informed of. As you know, we have our proposed annual CIP project to advance our initiatives throughout the city. As well, we have continuing to explore opportunities with Charter Communications for various different broadband and infrastructure initiatives in the city with our existing CARES Act funding. We also have our current 2021 Virginia Telecommunications Initiative VATI grant that we've partnered with Charter on. Also, we'll be working very soon in the coming months with Charter once again for our 2022 application for a VATI grant. We also have our participation with the Southside Regional Broadband Authority, which is the regional effort that we participate with Virginia Beach, Norfolk, Chesapeake, and Portsmouth to bring about a regional connectivity ring in our area. Of course, we're always courting new service providers for the city of Suffolk to offer options to our citizens. And as always, we continue to reinforce Suffolk's strong relationship with Charter Communications through working on our Rural Digital Opportunity Fund, which is what we have here tonight to present you guys with. So what is RDOF? The Rural Digital Opportunity Fund is a federally funded initiative, and it's administered through the FCC, which is the Federal Communications Commission, and is designed to inject billions of dollars of infrastructure into rural areas and into the operation of those rural areas for broadband networks. What makes this funding entirely unique from anything we've dealt with before is that this comes from traditional high-cost universal service funding, and it's not dependent on legislative appropriations. So what it means is the funding is there right now, it's just waiting to get spent. So who can apply for these funds is kind of a little different, but the FCC has program parameters that require the applicants to be eligible telecommunication carriers, which is a designation that these carriers have to go through a state regulatory commission to obtain. So basically, only established internet service providers are eligible to receive these types of funds. You'll see here on our lovely map of Suffolk all these green areas. So these green areas are mostly our rural unserved areas within the city of Suffolk, which are Whaleyville, Holland, some areas of Chuckatuck, and other areas up there are not part of Suffolk, so just ignore those. CCO Holdings is what you see on the map here. That's a subsidiary of Charter Communications. And so with this award, Charter is proposing that they will be able to serve approximately 1,759 homes within the city of Suffolk's most rural areas. So our Whaleyville, all of our areas that we've been working really, really hard on to get services, this funding is going to help with that a lot. So, along with Charter Communications, there were 3 additional providers who've yet to make contact with the city of Suffolk, and they've been awarded some of these RDOF monies as well, but not nearly on the same level of scope as Charter Communications. Shifting back to Charter, who does business now in the city of Suffolk as Spectrum, Charter will be providing high-level internet, which is gigabit level, 25 by 3 megabytes per second level internet, to our more rural areas to, again, cover the 1,759 addresses in our rural areas. In addition to providing those high-speed internet services, Charter Communications is also going to be able to provide their Spectrum mobile service, which is like a cell phone carrier. They'll also be providing their Spectrum TV and Spectrum Voice home telephone offerings in these areas, which currently these areas do not have those types of services at all. So the next steps we have for you guys in the coming months are that we're going to have some Charter Communications representatives coming out, and they're going to be making a formal presentation on what their plans are and how they're going to begin working in the city of Suffolk to really get this this initiative off the ground and get moving. That's planned for the spring. We don't have a specific spring date, but we know that it is going to be planned for the spring. We're going to continue to explore our opportunities to advance our broadband infrastructure through utilizing our existing CARES Act funding. And we're also we have some amendments to make to our 2021 VATI grant application. And then we're also going to be working, like I said, in the next couple of months to begin our 2022 VATI grant application again. And that's all we have tonight.
Council, questions, comments? Councilman Fawcett.
Miranda, Thanks for the brief that you just gave us. Just a couple things on the VATI grant. Do we know we getting anything for the 21? Or,
So here's the situation with the VATI grant. Because we received these RDOF funds, the RDOF funds are federal funds, and the state does not like a crossover with federal funds and state funds. So we have some of our areas that we applied for our application kind of cross over into those federal funds, and we're going back and making those amendments. I don't know if you guys heard anything in the news recently, but VATI actually came out because of the way that RDOF was staged out, the timeliness of it all. They basically told them that that VATI could have longer to make their determinations. So they've been rolling things out in phases. So
the Fed funds.
the big funds are the RDOF
Yeah,
funds.
the RDOF funds.
Yes.
Does Charter already have those funds in hand, or is
No.
that something forthcoming?
So
in-
this is very, very preliminary. We were actually just made aware of this news on Monday and put this all together to be able to introduce this to you because it's really, really exciting
I mean,
news
I'd
for
like
our
to-
rural areas.
Yeah, I'd like to see a timeline of when those Fed funds are going to come to Charter.
Yep.
You know, because we're really starving for this broadband to get this connectivity out to Holland and Whaleyville.
Absolutely. And so
So-
that's,
Councilman, if I may inject, they've been awarded those funds. Now, they're still working on, of course, lawyers and paperwork and all that. But the regulations, and Randa, correct me if I'm wrong, there's a 6-year spend down on this, okay? That's why it's important, as we talked to Charter the other day, and we talked about CARES Act funding, what can we get started initially? And so we're going to have more discussions with them. They're open to those discussions. The reason they didn't move on earlier because the funds had to go back at the end of the year last year until it was extended. So we have an opportunity there to, and that's why Randa had it on the slide as a bullet, to expedite some work. I'm not saying it's going to take 6 years, don't get me wrong. I'm hoping it's shorter, but the requirement spend down on them to get the money, they have to have it done in 6 years. Now, they have funding clear across many other areas in North Carolina and other areas across the country where they serve, and all of them are going to have a 6-year spend down on it. So we're hoping that, you know, it's not 6 years, but it's something coming, and we're going to be working, even trying to short-term some of this stuff this year if we can.
So is Charter our service, or Spectrum is our service provider here? Are they ready to ramp up and go at this thing, or are they pre-planning, or are we going to just get the money and then we got to get a whole bunch of people in here to ramp this thing up? Because this is going to be a major project.
It's a major project, and it's our understanding they will be ramping up, construction-wise.
Well, I know y'all are working hard at this, but keep pushing as hard and fast as you can. Grab any dollars that are out there, and hopefully we're going to give our folks out there something.
And the 2.6 is a grant that they received. They have to put in some of their own money, too, so it's a much larger project than 2.6 million.
so do you want me to speak? Okay, so the plan for over the duration of the 6 years is that Charter themselves, the company themselves, will be investing $5 billion, not million, $1 billion into these projects on the Eastern Seaboard. Charter serves a lot of localities in the Eastern Seaboard, and that's $5 billion specifically in these areas. And to answer your question about whether or not they're ready to ramp up, their plan is to be here in the spring and present their plan to you guys formally.
It'd be exciting to have them come in and tell us what they're going to can and can't do or whatever. Thank you. Appreciate it.
Councilman Johnson?
Brenda, thank you. I know you've been working hard on this. I have 2 questions. Back to the VATI grant for 1 second. The VATI grant that was going to bring Charter into Whaleyville, I thought we had secured that, no?
There are areas in Whaleyville that have services right now, Charter services,
Right.
but there are other significant areas in Whaleyville that do not have
So that
services.
bit of money is not going to be there anymore, it doesn't look like, maybe.
No, so that's not the case, no. So if you go back, actually, and we'll go back and look at this map. If you look at the map, the majority of the areas that you see here that are in green are areas that have no services at all right now.
Right.
And it's the same in Holland, same thing in Holland, where there's a lot of areas, the more rural areas, as you get, down the secondary roads and you really start traveling out, those roads that don't have any services at all, those are going to be the areas. Now, if you're asking whether or not we had received VATI grant funds in the past, no, we have not. We have an active application right now, and we have to make amendments to that application to be able to push it through, due in part to the RDOF maps being released.
And then my other question was that you said it's going to affect 1,759 households. How many households do we have in these rural areas that, do we know? That's a hard question, I know.
I don't know, but I can tell you this. This is significantly better than our VATI grant application, because that was going to only affect 415 homes in that
Exactly.
area.
But I hope that this will be an ongoing process that we'll continue to work with till we get it into every home that wants it, right?
Absolutely. That's the aim and goal.
Okay, thank you.
Yes, Council? Randy, thank you very much for your presentation, and thank you for all the hard work that you do behind the scenes. I know, speaking to the city manager, you've been on all these initiatives. This is probably one of the best stories we've had. As you mentioned, the money's there, doesn't have to go through any legislative process, which is a huge stumbling block lots of times, and it absolutely is just part of the continuing efforts that the city manager and staff and everyone is doing to try to satisfy internet access in the rural areas of the city that don't have it, which is definitely a top 3. So thank you very much, and thank you for all your efforts.
Thank you. Have a good night.
At this time, we'll consider the removal of items from the consent agenda and adoption of the entire agenda as presented. Removal of any item from the consent agenda would only be necessary if any member of City Council wishes to vote on a specific item separately, and a motion would be required. Questions and requests for information on specific agenda items can be addressed through the consideration of consent agenda after the agenda speakers. If there are any items a member of City Council wish to remove from the consent agenda to be voted on separately, a motion would be appropriate at this time. If not, then a motion to adopt the entire agenda as presented would be appropriate at this time. Councilman Fawcett, Councilman Goldberg with a second. Any discussion of the motion? If not, Madam Clerk, please call the roll.
Councilmember Fawcett?
Yes.
Councilmember Goldberg?
Yes.
Councilmember Johnson?
Yes.
Councilmember Ward? Councilmember Williams?
Yes.
Vice Mayor Bennett?
Yes.
Mayor Duman?
Yes.
The motion is approved by a vote of 7-0.
Okay, we'll now move to agenda speakers. Madam Clerk, are there any speakers at this time?
No, Mayor Duman.
We'll move forward with the presentation of the consent agenda. Madam Clerk, please present the items for consideration.
Item number 7, an ordinance to accept and appropriate CARES Act Coronavirus Relief Community Development Block Fund grants from the United States Department of Housing and Urban Development. And item number 8, a resolution to accept a donation of personal property for the Suffolk Department of Fire and Rescue.
Mr. Manager, please provide an overview of the items.
Mayor, Vice Mayor, members of council, the city has, in regards to item 7, the city has received $323,149 in CARES Act Coronavirus Relief Community Development Block Grant funds from the United States Department of Housing and Urban Development. $150,000 will be utilized by 4 kids, and the remaining $173,149 will be utilized by the Geneve Shelter. Adoption of the ordinance will increase the revenue expenditures of the consolidated funds by $323,149, and there's no local match required. In regards to item 8, the city has received a personal property donation from Lowe's in the value of $1,199. The item is a Weber Grill and was donated to Fire Station Number 3. Adoption of the resolution is necessary to accept and record the donated property for the Department of Fire and Rescue operations.
Okay, are there any questions? If not, a motion would be in order.
So moved.
Councilman Fawcett, Councilman Williams, a second. Madam Clerk, please call the roll.
Councilmember Fawcett?
Yes.
Councilmember Goldberg?
Yes.
Councilmember Johnson?
Yes.
Councilmember Ward?
Yes.
Councilmember Williams?
Yes.
Vice Mayor Bennett?
Yes.
Mayor Duman?
Yes.
The motion is approved by a vote of 7-0.
Okay, we have one public hearing this evening, an ordinance authorizing the acquisition of real property in fee simple and/or permanent and temporary easements, either by agreement or condemnation for the Nansemond Parkway, Wilroy Road overpass over Commonwealth Railway project. Mr. Manager, please provide an overview.
Yes, Mayor, Vice Mayor, council members, at this time, I would like to call Mr. L.J. Hansen, Director of Public Works, to the podium to provide the staff report.
Good evening, Mayor, Vice Mayor, members of City Council. It's my privilege tonight to discuss this project with you and seek your authorization to move ahead with right-of-way acquisition. This is a project we've talked about a number of times, and it's a long time coming. Just a little bit of review as to the project objectives. I'm sure all of you are familiar with the intersection in question, but the objectives for the project were to improve safety at the intersection resulting from near head-on collisions. As you recall, when a rail blockage occurs there, we have some congestion, folks trying to drive around. We've had a number of near head-on collisions at the intersection, either in the intersection or on Nansemond Parkway leg. Eliminate backups, those same backups that occur at the intersection caused by drivers waiting on rail blockages. And this is predominantly for people that are north or west of the rail closure trying to go on the south leg of Nansemond Parkway. When they stop, that causes folks behind them to not be able to proceed as it's a two-lane road and there's no room for bypass. Eliminate the need for police presence during rail closures. One of the temporary measures that we took to help alleviate this issue was to force a right if you're on Nansemond Parkway traveling south, or to force drivers to move in a left turn going north on Nansemond Parkway if the rail is blocked. Despite the arrows, the flashing lights, and the signage, we still have people who are not doing what they're supposed to do. And as a result, our police department has to man that location frequently in order to enforce the signage and the force. Preserve the usefulness and viability of the primary north-south connector. I've talked at length before about the importance of this route. The Wilroy Road, Nansemond Parkway corridor is essential to the growth, the development, the safety, and transportation needs of the city of Suffolk. This is a primary corridor. We have public safety personnel that traverse it multiple times a day. Schools use this route extensively. Obviously, all city staff and the traveling public. And of course, anytime we have an issue on the 6th lane, this becomes an even more critical link. The last bullet I had here was to talk about increased safety at the rail crossing by installing a grade-separated flyover. Last month, I gave a presentation to council talking about some of the issues that we have, and if you recall, there was one incident where we had a vehicle-rail interaction at this location. A little bit about the history of the project. Seems hard to believe in some ways, but very easy to believe in other ways, that it's been 5 years since my predecessor, Eric Nielsen, stood here and asked for permission to move ahead on the slip lane project. If you recall, there was a project before this project that would have resulted in a single right-hand turn lane, slip lane, to allow for traffic traveling south on Nansemond Parkway to be able to make that movement around stop traffic. That was in April 2016 that the public hearing was held for that project. In March of 2017, we were informed that we received about $16.2 million in federal assistance. The grant came from DRPT, but it is federal money. The application scope on that, for that grant was that we would provide a grade-separated crossing, meaning a flyover, with a standard three-way intersection, meaning that there would still be means to traverse through this in a conventional manner. In December 2018, after we had started our preliminary design work, the city public works staff had an initial meeting with the Bridlewood community. We recognized early on that this was going to have impacts to that community. We did meet with the Bridlewood Homeowners Association in December of 2018 to kind of give them a heads up of what would be going on. In the time since this project has kicked off, there have been 5 updates to City Council in 2018, 19, In November 2020, we had a subsequent pre-public hearing meeting with the Bridlewood community. We held this in the Bridlewood community. They have a roundabout in the center of the community. We did invite members of the community out to come talk to us and discuss their concerns with the project. And then also in November of 2020, we did hold a public hearing is consistent with VDOT standards at John Yates Middle School. In January, just last month, we did talk a little bit about it in the Rail Crossing Review staff report. And then, of course, tonight, we're here to seek authorization to move ahead. At this point, you should be familiar with the project, but just as a means of review, this slide is not oriented north-south. To the right of the slide is Nansemond River High School. To the left of the slide is Wilroy Road traveling south to downtown. The reason I have to orient it like this is otherwise it wouldn't fit on the screen, and this is the only way to get the whole project in there. It is a big project, and it does take up a little bit of land. Some of the elements of the project are, one, the road currently bends here at the Bridlewood community, comes to the intersection, makes another turn, and traverses south on Wilroy Road. And the reason I'm pointing out that part of the movement is because that's the primary movement. All of our traffic studies show that at a ratio of about 2 to 1, or at least 2 to 1, that the primary movement is not Nansemond Parkway to Nansemond Parkway across the railroad crossing, but rather Wilroy Road to Nansemond Parkway, or Nansemond Parkway to Wilroy Road. So what we're doing is we're creating a geometric alignment that facilitates the primary movement. So while Nansemond Parkway comes to here, and then it would do this in name, the truth of the matter is the traffic flows in this manner. Some of the other elements that are included is the flyover, the grade-separated crossing that will go across both Wilroy Road and across the railroad track before coming down here. There's been some misconceptions that this is up in the air. None of this is up in the air. This is all at grade. The intersection is at grade. All of this is traditional road at grade. The only flyover part is here when you get up in the air to go across. A couple of other items I wanted to point out was that we do preserve access to the business that's located here, the automobile repair business that's located here, as well as to the residents and the other properties that are located in here. Some of the features of the project, as I mentioned, is to realign Nansemond Parkway and Wilroy Road, to eliminate the geometric issues that exist, and to protect the natural predominant movement. Obviously, the grade-separated crossing of the Commonwealth Rail Line is a huge safety feature. Improved signalization without a need for rail preemption, so we no longer have to worry about whether there's a train there or not. It's not going to... there are pedestrian multi-use trail improvements that are provided, stormwater improvements, which are necessary for the project, and roadway cross-sections will also improve safety, and I got a little slide to kind of show you that. If you're familiar with the area, and I know most all of you are, we currently have ditches adjacent to the road pavement right now with the addition of the curb with the addition of the curb and the gutter, as well as the sidewalk and the multi-use trails, 12-foot lanes. This is a much safer road than what we currently see out there today. Also, I wanted to touch a little bit on community involvement. We have tried our very best to be involved with the community. This project itself is a result of community involvement. Over the course of years, we've received hundreds of complaints, mostly through phone calls and reaching out to City Council, complaining about the safety issues, the near head-on collisions that occur at the intersection. We have met with the Bridlewood community twice during the design and development process. We've also met with other communities and other interested parties up and down the corridor. We had the public information meeting, which is, again, consistent with VDOT requirements. And I like to remind you that this process tonight is not a VDOT requirement. This is a city requirement that we do to authorize us to be able to move ahead with right-of-way authorization. So we have satisfied all of the VDOT requirements, including our including our environmental review. All of that is satisfied, so at this point, we're really looking for City Council's go-ahead. Following that meeting, we did make a couple of, we did have one recommendation of an alternate alignment that could be considered. City staff and our consultant reviewed that alignment, that potential design consideration. Ultimately, we decided it was not suitable for this project. I understand that there might be some questions about that. We do have a representative of our design team here tonight that will be able to answer any questions about why that was, but it was not deemed to be appropriate for this project. I will say we also received feedback during the public the public information part that we did adopt into the project, and that had to do with berming, trying to create a berm along the avenue where the road would be directly adjacent to the horse pastures. By creating some berming, we believe that we can create some sound baffling and hopefully some other things that might facilitate with the horse operations. I would tell you that the Virginia Department of Rail and Public Transportation and Commonwealth Rail have both submitted letters in support of the project. I know this chart is hard to see, it's hard every time, but the point I really want to get across here on this is that there are a number of property impacts. We're aware of that. We are always mindful when we're designing a project about the impact it's going to have to the community, to the individuals that are in the community. We do not anticipate any full takes, and there are no residents that will be displaced as a result of the project. Next steps after tonight's public hearing, we hope to move to right-of-way, which would be this spring. Advertisement for construction, we believe it'll take us about a year to wrap up the right-of-way and the utility relocations. One of the nice aspects of this project is that it is not done adjacent to a road, so we don't have a lot of utility relocations. And also, we will not have a lot of traffic interruptions because we're not doing a lot of work that's directly adjacent to an existing road that's already stretched. Construction commencement beginning in 2022 and wrapping up in 2024. This is a public hearing, and my staff and our consultants stand ready to answer any questions upon conclusion of the public hearing.
Thank you. Before we open the public hearing, Madam Clerk, please explain the timing system.
This is a public hearing, and each speaker is asked to provide their name and their address and will receive 3 minutes to offer their comments.
This is a public hearing. Will the first speaker please come forward and provide their name and address?
Good evening, Mayor, Vice Mayor, members of council. My name is Chris Jensen. I live at 304 Bridlewood Lane, Suffolk, Virginia. I'm here this evening to request you vote against the proposed Nansemond-Wilroy Railroad overpass project, both as a concerned citizen and as president of the Bridlewood Estates Homeowners Association, a neighborhood of 24 homes with an attached equine center that will be severely impacted by this project. Instead of trying to cover all the issues that I provided to you last week in a separate correspondence, tonight I just want to focus on 2 points. First, throughout this process, private citizens should not have to come up with alternatives that can be completed by the City Public Works Department. We were first contacted 2 years ago about this. We made our voice clear at that time that the project obviously had other ways that could be considered, and over the course of 2 years, none of those alternatives were developed, looked at, or cost analysis, cost-benefit analysis, alternative analysis, none of that was done. Through multiple FOIA acts, I've asked for those documentations, and there are none, because the city failed to look at any alternatives other than the one that they zeroed in on from the very beginning. 2 years later, after our first meeting, despite promises that we'd be kept in the loop, that we would receive information on the progress of this project, and hearing nothing from the Public Works Department for 2 years, we get approached with a final design and are basically told, suck it up, this is what it's going to be, it's too late to make any changes now. So that's when I kicked into high gear. I've spent probably close to 100 hours trying to find ways and identify ways that this could be done with less impact to Bridlewood Estates, less taking of private land, and every issue that the city has thrown back at us for the alternate exit loop plan that was mentioned by Mr. Hansen, is addressed. I mean, they've thrown back not being, that the turn is too sharp. It's easy. You just round the curve a little bit. The city's already acquired that land. They already acquired that land when the slip lane project was planned. So there's no remaining issues. So I don't know what they're going to say tonight. That might be new information, but take it for what it's worth. It'll be new stories. It's not any analysis that's ever been done before. It's all been done in the last couple of weeks. The other point that I want to make is that the primary responsibility of all local, state, and federal government employees, one of those jobs is to make sure that we maximize the use of taxpayer dollars responsibly. And in this case, there's an alternate plan that would cost at least $5 million, probably closer to $10 million less in land acquisition, construction costs, and require less taking of land. And I don't know how we can ethically vote to approve a project when there is less expensive alternatives. I know the Public Works Department says that we're too far along in the process to go back to the drawing board. I would argue that until the project is actually approved and given that go-ahead, it's never too late. I mean, to say we can't spend 4 or 5 months and a couple $100,000 to save $5 to $10 million seems ridiculous. So in conclusion, the current Nansemond-Wilroy overpass design has so many problems in so many areas that I believe the only reasonable and ethical thing to do this evening is to disapprove the design and require the project to be reevaluated. Thank you.
Next speaker, please.
Good evening, Council. My name is Carl Jackson, resident of 106 Rochdale Lane on the Mansfield Farm community. And I came here to speak in support of the project at Nansemond and Wilroy Road. Basically, I speak for a lot of commuters that are frustrated with the traffic and congestion created by the trains. Since I've been here, the trains have gotten longer and slower, and they've even stalled at the intersection. The city has put in the flashing yellow light to make that right turn. People ignore it, so they sit there and wait. They make us wait further down the line. I've also seen near collisions, people trying to go in the opposing lane to go around the vehicle. And at some point, you're going to have a serious accident and a problem. Same on the south side of that project. You have the train completely blocking the intersection. And now the game is for people to actually outrun the train before the bar comes down. It's a very unsafe situation. And I understand the, the concerns expressed by the Bridlewood community. We have to think of those of us who are upstream, who are living in other areas, who have places to go, who need emergency vehicles, who have children in school, looking out for school buses. There are a lot of concerns that need to be addressed, and I support the city's project to improve this intersection. Thank you.
Sir. Our next speaker, please.
Good evening. Mayor Duman, Vice Mayor Bennett, City Council members, thank you for allowing me to speak. My name is James Dalton. I live at 307 Bridlewood Lane in Suffolk. I would like to speak in opposition to this project and its current design. Like Mr. Jensen, who has written and stated to both the Public Works Department and City Council, I too feel this project could still be accomplished at significant lower cost to the City of Suffolk taxpayers by utilizing the proposed alternate design solution he sent to the Public Works Department, in which was subsequently and quickly dismissed, citing safety concerns over the curve at the railroad crossing that is presently in use, with little to no history of safety issues reported. They also stated that redesigning at this stage would put the project even further behind. That would not be an issue if all design possibilities were explored from the beginning. In addition to lowering the cost to taxpayers, this alternate design could alleviate extra and no doubt hidden cost and years of work for the residents of Bridlewood Estates in response to the city's acquisition of a significant portion of Bridlewood Estates property and jeopardizing the equestrian center, for which many homeowners chose to purchase and live in this community. the cost of moving the equestrian center and its associated buildings, possible purchase of additional lands to make up for the loss, maintenance to parcels of land that we can no longer use, and possible rezoning and all the issues that come with that, not to mention the inevitable mounds of lawyers' fees that will be quickly adding up. Please understand, I am not opposing the project overall. It will help alleviate traffic issues and, most importantly, emergency service access to other surrounding communities. I and a majority of the homeowners in Bridlewood Estates simply want this to end up as a win-win. You and the railroad company can still eliminate the at-grade crossing. The surrounding communities will receive better emergency response. Traffic backups can be avoided, and we can continue to live peacefully in the neighborhood that we chose in its current state. Mayor, Vice Mayor, and Councilman, I ask that you vote no on this project in its current design and ask that the Public Works Department to please adequately consider Mr. Jensen's alternate plan. A vote of no will show the City of Suffolk taxpayers that you are looking out for their best interest, and will also show your constituents that you hear and consider their voice to be vital towards the decision-making process of the City Council. Thank you.
Speaker?
Mayor, Vice Mayor, council members, my name is Kevin Robinson. I live at 203 Bridlewood Lane. I moved to this area about 2 years ago and was really excited to find Bridlewood and the surrounding areas. I would like to express my agreement with the argument stated by Mr. Chris Jensen, asking for you to disapprove the current Nansemond-Wilroy Overpass project construction plan and instead consider Mr. Jensen's proposed plan. First, the Public Works Department is incorrect in its insistence that the HRSD had not approved the previous turn lane proposal. This turn lane would also address police presence and safety at the intersection. Second, the current proposal is not in compliance with ADA and U.S. Access Board construction requirements. And most importantly, a mutually beneficial solution that could provide emergency vehicles access to many homes, communities, a church, and several businesses at Shoulders Hill and Nansemond Parkway. I respectfully ask that you reconsider the current design proposal in favor of a plan that also addresses additional concerns for use of public funds and public safety and access. Thank you.
Speaker? Hearing no additional speakers, this public hearing is now closed. An ordinance is presented for council's consideration. Council? Councilman Fawcett?
If I could just ask LJ to come up, and got a couple of questions. Just refresh my mind again, because I know it was on the screen, but I was doing something at the time when we started this project. How many years ago?
5 years ago it was April of 2016 when Eric Nielsen came seeking permission to move ahead. But this particular project was started in 2017.
And if I remember right, we were getting ready to enter in, and I think most of the council members are on here, we were getting ready to enter into a process to create a slip lane right there off of Nansemond Parkway on the Wilroy. But after consideration, and I believe our delegate at the time, Chris Jones, had worked along with our previous mayor to negotiate through some Hampton Roads dollars, or state dollars, through Hampton Roads Transportation, to help facilitate taking part of this cost for this intersection and overpass and roadway correction. Am I right?
Yes, sir. It's tied to the Department of Rail and Public Transportation and federal dollars to provide safety improvements at grade crossings, and that's what it was for.
You stated there was a 16.2 million grant, federal money. What was the state part of that and the city part, and what was the total dollar for the project completed rolling up and down the road?
Current budget for the project is $24.83 million. Now, I mentioned 16.2 million of that is federal dollars, so the remaining, I'm doing quick math in my head here and say the remaining $8 million is a split between local and state revenue share dollars.
It is true, and one gentleman that came up that talked about he was in favor of it, and it's very true that Nasmith Parkway can be a challenge. And just because when we have an incident on 58 or 664, that traffic has got to dump somewhere. And it dumps, and I know it because I've been in it, I've sat in it. It dumps off onto Bridge Road, and it works its way up Shoulders Hill or down Bennett's Pasture, and it ends up coming on to Nasmith Parkway. And then it's kind of stuck. And if you got a train that's there, and we all know that train rolls up and it does a slow roll, and we've had some problems with the train blocking the intersection for quite some time, doing shift changes, and all kinds of little incidences. And we can't control the federal rail to start with, so it'd be nice if we could tell them what we want them to do, but it doesn't always work. You know, and with that, nothing moves. I've been in that traffic all the way back, way down Nasmith Parkway past Nasmith High School. And that takes a long time for that traffic to get started and cranked up again, because you got the ones that want to go across and you've got the ones that want to go on Wheelroy. And I have experienced the fact that, you know, emergency responses are tough because the fire apparatus has got to either redirect or an ambulance can't get up Nasmith Parkway. It's impossible. So if you had an incident at Bridlewood anyway, and you had a medical emergency, somebody's in trouble because the response time is going to be somewhat real slow. So, and I know for a fact, I've been in it, I've seen it, and almost got hit by a driver coming off of Wheelroy on the Nasmith Parkway because of that train blockage, and almost got hit because they want to come around the traffic while you're trying to make that turn onto from Wheelroy to Nasmith Parkway. And I've had to get over, and you know, there's nowhere really to go because there's a ditch there on one side. And you go in that, you're done. So this project has, I realize it has a lot of moving parts to it. There's been a lot of discussion. You know, I'm just curious to whether or not if we push this back and continue to look at other ways, and there's always going to be somebody coming up with another method of how this should work. And I'm not saying they're wrong, but, you know, we stand to lose some substantial money here if we keep pushing these projects back. The one thing that concerns me is in futuristic projects, is the state or the federal government going to be willing to play ball in Suffolk because we can't get a project across the finish line? And I'm worried about that because we don't have the funding in our city to be able to fund these roadways. Without the assistance of both the state and the feds, some of these projects are impossible to do because the price tag is so far forward you can't get to it. So I'm really kind of have mixed emotions about this, and I know we're taking a pretty good chunk of Bridlewood. I don't know what the exact acreage is. Maybe you could tell me how much acreage we're taking, because I know we're going to flare that roadway behind the Sesam's home that's in historical landmarks. So we can't mess with that. So
there is one parcel that exists that is the parcel that has the horse facilities on it. It's 23.36 acres today. We are asking to acquire 4.96 acres of that parcel. That would leave a total of 18.4 acres. To be clear, though, that is not a contiguous piece. 13.6 of that is contiguous to what is currently there today. So they currently have 23 acres, of which they would have 23 excuse me, they currently have 23, they would remain 13.6 acres. There would be about a 4.8 acre remnant parcel on the other side of of the Nansman Parkway project.
So you have the consultant here, right, in the
Yes, sir.
project. Is it possible for the consultant to come up and tell us why? I'd like to hear why the other things that were submitted are not viable to use for this project.
Absolutely. Let me present Ian Johnston with Clark Nixon. He is our prime consultant for this project.
Mayor, Vice Mayor, members of council. So talking about why the alternate proposal isn't a good plan. So the basis of what we're doing is first and foremost, we're fixing the at-grade issue. But when we start planning the project, we work off of current planning studies, which is the 2035 comprehensive plan. The comp plan, and LJ indicated this earlier, the comp plan has identified the Nansman-Wilroy corridor as a primary corridor to be upgraded to a standard. It's actually referred to as an urban minor arterial. The projects to the east that were recently completed, Shoulders Hill and Nansman Parkway, and also Nansman Parkway Portsmouth Boulevard, that was a combined Suffolk City of Chesapeake project. That's the initial stage of the improvements. It's those types of improvements and upgrades where we have to meet certain geometric criteria to get that arterial standard is why running along the existing alignment is not really feasible, because we have to, and this got brought up before, improve the curvature so we can meet a certain speed. But we also have to drain the roadway improvements. And in order to do so, we're putting in storm drain systems. And I know the HRSD force main has been brought up quite a bit. There's no question, if we widen and improve on existing alignment where the 30-inch force main is, and there's also a 16-inch water line, we've got a 6-inch gas line, multiple utilities through the existing corridor, we will conflict with those. The other perspective or point is that trying to build on top of the existing roadway with these new improvements makes it difficult and costly for the construction process. Another point, and this really came up during, this is probably about circa 2018, when we were looking at the concepts for where the flyover was going to be located. One of the initial concepts was the flyover was going to go basically through the center of the Sessoms property. The Sessoms property is a late 18th century, constructed around 1800, and through our environmental review process with the state, DHR, and FHWA, it was determined that that property was eligible for the National Register. Once that indication has been made by the agencies, that invokes what's called Section 4F of the 1966 DOT Act, which provides certain protections for that property. You have to prove feasible, basically you have to exhaust all alternative analysis to show that there's no other option to impact. So the fact is that property fronts on Wilroy Road, and if we make the improvements on the existing roadway alignment, we're going to impact that property, and we'll have to go back through the environmental process. And I would just say this, that the agencies, I think, would take a very stark look at that, because we've already gone through the process and there are alternatives not to impact that property. So that's really the reason. Could the alternate proposal work? Yes, but it does not conform with the 2035 comprehensive plan, which is the basis of what we're trying to implement.
Just one last question, and you talked about the utilities and the alignment. Number one, if in the future the Nansman Parkway is improved to another 4-lane roadway, this will align with that, correct, without any additional construction issues, correct?
So what we're currently doing, and the comprehensive plan does call for Nansman Parkway and Wilroy Road to be widened to 4 lanes. What we're doing now is constructing 2, but to facilitate for the future 4-lane widening.
If you had to do another design plan, you'd still have the same impacts, do you not?
There would certainly be impacts. The other things to consider here is, and I brought up the stormwater management requirements, we would still have to place basins, and we're draining the project to the Nansman River. So I would still, vouch that there would be impacts to Bridlewood, not to the extent that we're currently impacting, but we would still very likely need to place a stormwater management basin on that property to drain the eastern portion of the project.
Thank you. Thank you.
Question, comments, motion? Vice Mayor?
Yeah, I just had a question on, put the map back up where it goes across Bridlewood, if you don't mind. I know you covered the acreage and the amount of land that would be affected. So what you were saying, where it's going across, they will not be able to use any of that property, the 2 acres, 2 point whatever acres that you were saying that behind it.
There's a remnant parcel that's here. We're not saying they can't use it, sir. We're just saying that it's physically disconnected, and that would be something that would be needed to consider.
Well, how would they be able to use it as far as getting horses across that road to use it?
That's not a question I can answer. I'm not really an equestrian expert. I know that the members of the community have expressed that they don't feel that they could use it for that purpose. Horses would have to go across the road if that was to be used for that purpose. They do, however, have other property in the Bridlewood community that is not affected by our project that they currently use for horse operations. So this is not the entirety of that horse operations for the community. This is that parcel, that 23-acre parcel, though, that we would be impacting.
Mine were covered, you got them, they were covered before, so I don't have any. Good, I'm good.
One question, LJ, would the Bridlewood Estates be compensated for that 23 acres that we're making useless? How does that work?
We would compensate them for the part of the purchase that we're acquiring, and then there are other rules that are factored in during that process, similar to any other transportation.
Sure, but they're not going to have access to that property, is what you're saying, right?
The residual parcel?
Yeah.
That is something that we'll negotiate as we go through the acquisition process. I'm not entirely sure. Yeah, they'll have access. It's their property. So it's their property. They still have access, but it's disjointed from their existing 13-acre parcel.
Questions in
One
order?
little question for LJ. I'm sorry, Mayor, but I appreciate it. They have access to it. Will we provide them an entrance to have that access to off of?
Yes, sir. Probably not from Nansman Parkway. We would probably request from the Wilroy Road, the loop that comes down. Loop that comes down here. We would probably seek to gain access here rather than to put it on the arterial. We would probably have access from this area.
That would get them to the piece that they wouldn't have to cross the road with?
For vehicle access, yes.
Yeah, I got you.
Questions, comments,
Thank
motion?
you, Mayor. Done.
Councilman Fawcett?
Nope, I'm good, thank you.
What's the,
It's a motion.
you want to make a motion? I move for approval, Mayor.
Move for approval?
Move for approval.
Okay.
Second motion.
Second from Councilman Fawcett. Any further discussion of the motion? Hearing none, Madam Clerk, please call the roll.
Councilmember Fawcett?
Yes.
Councilmember Goldberg?
Yes.
Councilmember Johnson?
Yes.
Councilmember Ward?
Yes.
Councilmember Williams?
Yes.
Vice Mayor Bennett?
No.
Mayor Duman?
Yes.
The motion is approved by a vote of 6-1, with Vice Mayor Bennett voting in opposition.
All right, there are no ordinances this evening. We do have one resolution, resolution appointing Holt W. Butt as the city assessor. Madam Clerk, will you please read the resolution?
Whereas City Council has determined that Holt W. Butt is the most qualified person to serve as the city assessor, and whereas it is the intention of City Council to provide the city assessor with other benefits and working conditions comparable to those provided to employees of the city, now therefore be it resolved, the City Council of the City of Suffolk, Virginia, hereby appoints Holt W. Butt as the city assessor of the City of Suffolk effective February the 16th, 2021. Be it further resolved that Holt W. Butt, as the city assessor, shall be paid an annual salary of $128,000. Be it further resolved that all provisions of the city charter and code and the regulations and rules of the city relating to retirement, vacation, maternity, sick and other leave, insurance, holidays, and other fringe benefits, and working conditions as they now exist or hereinafter may be amended, shall also apply to the city assessor as they would for the employees of the city. Now be it further resolved that this resolution is effective upon its adoption.
Motion is in order. Councilman Fawcett, Councilman Johnson, second. Is there any discussion of the motion? Madam Clerk, please call the roll.
Councilmember Fawcett.
Yes.
Councilmember Goldberg.
Yes.
Councilmember Johnson.
Yes.
Councilmember Ward.
Yes.
Councilmember Williams.
Yes.
Vice Mayor Bennett.
Yes.
Mayor Duman.
Yes.
The motion is approved by a vote of 7-0.
Mr. Butt, would you like to make a few comments before we move on? Congratulations.
Congratulations.
Welcome aboard.
Thank you, Mayor, Vice Mayor, members of council. I just want to briefly say thank you for the opportunity you've given me here. I look forward to being here on the 16th and getting started. I am truly humbled as I stand here tonight at the trust and faith that you placed in me, and I won't let you down. So thank you.
Congratulations very much.
Welcome.
Welcome.
We have no staff reports. We do have a motion to schedule a public hearing on February 17, 2021, to consider the adoption of an ordinance authorizing the acquisition of temporary construction easements for the Elwood Road Route 613 over Kings Ale Swamp Structure, number 8016 Bridge Replacement Project. The motion's in order.
So moved.
So move.
Second. Councilman Johnson, the motion. Councilman Ward, second. Madam Clerk, please call the roll.
Councilmember Fawcett.
Yes.
Councilmember Goldberg.
Yes.
Councilmember Johnson.
Yes.
Councilmember Ward.
Yes.
Councilmember Williams.
Yes.
Vice Mayor Bennett.
Yes.
Mayor Duman.
Yes.
The motion is approved by a vote of 7-0.
We have a motion to schedule a city council work session Wednesday, February 17, 2021 at 4 p.m. unless canceled. The motion will be in order.
So move.
A motion by Councilman Williams, a second. Second by Councilman Ward. Any discussion? Madam Clerk, please call the roll.
Councilmember Fawcett.
Yes.
Councilmember Goldberg.
Yes.
Councilmember Johnson.
Yes.
Councilmember Ward.
Yes.
Councilmember Williams.
Yes.
Vice Mayor Bennett.
Yes.
Mayor Duman.
Yes.
The motion is approved by a vote of 7-0.
We'll now proceed to non-agenda speakers. Madam Clerk, are there any, can you read the?
There are
you
non-agenda speakers this evening. Each person participating under the item of business entitled Non-Agenda Speakers shall limit their remarks to the services, policies, and affairs of city government and shall be permitted 5 minutes for the purpose of presenting his or her matter. Speakers appearing before City Council will not be permitted to participate in the following activities: to campaign for public office, engage in personal attacks, promote private business ventures, or use profanity. Speakers who violate these rules will be declared out of order by the presiding officer and will immediately yield the floor and be seated. Brandon Randleman, 148 West Washington Street, representing self, regarding support for a resolution for LW lawn service.
Good evening, everyone. Mr. Mayor, Mr. Vice Mayor, City Council members, and other government officials, I would like to say good evening to you. William Penn once wrote, "Right is right, even if everyone is against it, and wrong is wrong, even if everyone is for it. This evening I come before you wanting to ask one question: what is right, what is just, and what is fair? What is fair? I believe it is fair to say that Mr. Williams and LW's Lawn Service fairly bid and won this particular contract that we speak of in a competitive bid process prior to his service on the City Council. It is also fair to say that Mr. Williams only asks of one thing of this council, and that is to fairly complete, Mr. Williams and LW's Lawn Service would like to fairly complete their contract and their bid. I think we can all agree that this City Council aims to govern this city in a way in which any citizen or business that comes before this body is treated fair and equal. What is just? This evening you will hear from the employees who Mr. Williams have hired. These employees may not necessarily have a college-level skill set. They may not have a large fortune that they inherited from their parents. And some, yes, may have recently been incarcerated. But Mr. Williams did the just thing and gave them an opportunity to re-enter back into society here in the city of Suffolk by providing jobs for them so they can contribute back to our city. And we are asking that you all do the just thing by passing a simple resolution so that these citizens could keep their jobs. But the last part that I like about this statement from William Penn is what is right. I think we all know that the state of Virginia has given a legal opinion on this matter. I think we can all agree that the right and simple thing to do is to pass a resolution. By this body passing this resolution, it will continue to show the citizens of Suffolk that this council is in support of this small minority-owned business that has contributed so much, to this community. We may have our differences of opinions. We may have different political views. We may have different strategies in which we handle politics. But one thing we all share, and that is we share love for America, we share love for our Commonwealth, and we share love for the city of Suffolk. And because we share that value, I'm asking you to please do the right thing, even if everyone or a few is against it. Please, let's be fair, let's be just, let's do the right thing, and please pass this resolution. I thank you.
Steve Daniels, 100 Dawson's Lake Lane, representing Self, to speak in support of a resolution for LW Lawn Service.
Thank you, Mayor, Vice Mayor, City Council members. Pleasure just to get to speak to you real quick this evening. I'm not going to go into great detail as he did, but I'd like to speak to you as a compliment and appreciate the way you handle our city financially and fiscally. And I'd like to bring a little bit to the attention of that's why this contract was given. It was given for service and it was given for value. As a taxpayer, a business owner, and a homeowner, a resident of our city, we ask you to give us the best value. Continue the contract. Let us get our value. Thank you.
Reginald Bevins, 913 Kilby Avenue, representing Self, to speak in support of a resolution for LW Lawn Service.
Good afternoon, Mayor, Vice Mayor, City Manager, and all council members. It's an honor and a privilege to stand before you on behalf of Leodis Williams and to support the resolution. I don't want to get into a long detail about myself, but I was formerly incarcerated, came home in 2015, and when you are incarcerated, when you come home, you know, the deck is stacked against you, especially being this day and time, and the deck was seemingly stacked against me. I didn't have no confidence in myself, and just seemed like things was going downhill. So I reached out to Mr. Williams. Mr. Williams gave me an opportunity to strive, to support my family, and to just become a better person, to become a better person, to be a productive citizen in the city of Suffolk. And one thing I noticed about Mr. Williams, he loves people, he loves character, and he loves giving people opportunity. And that's one thing I took notice of as I was listening in on some of y'all's speeches when y'all was concerning other items. I saw the love that each and every one of y'all, Mr. Leroy, Mr. Foster, Mr. Williams, the Vice Mayor, and you, Mr. Duman, I spoke to you personally 1 or 2 times when you was campaigning. I see the love y'all got for the city of Suffolk. I see the love y'all got for the people. And I just wanted y'all to continue this contract with Mr. Williams and go forward with this resolution, because it not only impacts me, it impacts others after me. And I was thinking the other day, as I was beginning to know I was going to talk before y'all, and I noticed that as y'all open the meeting up, y'all open it with prayer of Christian character. So I said, this is a board of faith. And one thing stuck out to me as I do my studies. In the book of Acts, Paul talks about his missionary journeys when he was incarcerated, and he went before this King Agrippa and his wife Bernice. And as Paul was telling him his life-learned journey and how Christ had impacted his life, after he gave a fair amount of transformation, King Agrippa responded to him, said, Paul, you almost persuaded me to become a Christian. So you almost persuaded me to become a Christian, and that word almost stuck with me, because that means King Agrippa had opportunity to change and accept Christ and become a better person, but almost that means he was reluctant, refusing to do something. And King Agrippa, we keep in mind, he was responsible for a nation. And I look before the board, all of y'all are responsible for the citizens of Suffolk. My life is in y'all hands. Whether y'all know me directly or personally, y'all life, and not only my life, but life of others, are in y'all hands. And I don't want y'all to almost pass a resolution, because if you almost pass a resolution, that means it fails. And if the resolution fails, that means I may fail. That means people that's coming after me, that's striving, may fail. No, so it's an opportunity that we have as a collective group to stand together and do what's right. You know what I'm saying? I understand about contracts. We always want the best. You know what I'm saying? My mom used to always tell me, make people, you know what I'm saying? I try to do my own little landscaping jobs on the side. After I came, my mama used to always tell me, make people feel good about giving you their money. You know what I'm saying? You know what I'm saying? If I come to you do a job, I want you to feel good about employing me. And I feel good about working for Mr. Williams. I feel good and confident coming before y'all, pleading on behalf of not only Mr. Williams, but for me and for other people that will fall after me. You know what I'm saying? One thing my mama always taught me, you know what I'm saying, and it stayed with me, she said, all things work together for the good, for those who love God, those are called together according to his purpose. And I believe the purpose of this committee, the purpose of this board, is to find the best way to resolve any matters, especially for citizens of Suffolk, because one thing that separates Suffolk from this nation, Suffolk stands together. I've always seen Suffolk stand together. I've seen great political fights. I've seen Mr. Duman, you running against Linda Johnson and other people. I've paid close attention to you, Mr. Fawcett, and I just and when I see y'all, I said, these are good-natured people. These people got a good heart. They want what's best. I don't understand the politics of everything. Yes, I got stripes on me, but I want to be successful and strive. That's my goal, to be successful and strive. And Mr. Williams, give me the opportunity. And y'all give me the opportunity by just being able here to stand before y'all here today. I thank y'all. I'm going to close with this message, man. Follow your heart, and you can't go wrong. Suffolk is not like the politics and what's going on in this nation. And we see this nation divided. I thank y'all.
Your time's up. I'm trying to let you finish, but your time is up.
Okay, I just close this thought. I thank y'all, and may God bless y'all.
Thank you.
The next speaker is Trayvon D. Boone, 1227 Excalibur Court, Chesapeake, Virginia, representing self regarding support of a resolution for LW Lawn Service.
Honorable Mayor, Vice Mayor, City Councilmen, I am Trayvon Boone, 1227 Excalibur Court, Chesapeake, Virginia, pastor here at Suffolk Tabernacle Baptist Outreach Center on Nansemond Parkway. I want to speak briefly about fundamental fairness. Mr. Williams' situation here meets the bounds of the law. The vetting process occurred in 2019, and all the appropriate city agencies were involved. There was no conflict with the city when the bids were solicited, and the contract was entered in March of 2019. There is no conflict as of today. The only issue today is the automatic renewal of period, and the renewal was negotiated in 2019, well before Mr. Williams was on City Council. Mr. Williams and the community, we're only asking to be treated fairly. Mr. Williams is one that gives untimely to our city, provides resources for those unfortunate, sponsors his annual turkey giveaway. As you just heard from one of his employees, he gives an opportunity to those that society has kind of cast aside. And I simply want to say to you today, just to remind you and to put in your hearts and in your spirits, a job loss is a life loss. So we ask that you would do justice and grant this resolution on behalf of Mr. Leotis Williams. Thank you.
Jaden Pierce, 211 North Broad Street, representing South, to speak in support of a resolution for LW Lawn Service.
Good evening, councils. I am a high school senior at Kingsford High School, and I've recently been employed with Ms. Leotis at LW Lawn Firm for about a couple months now. I just want to say, I don't want to say too much, but he's given me the opportunity to make something of myself as a man. He's allowed me to work when there wasn't much work to be done, especially during the winter seasons. He's been willing to sit down with me, talk to me about my personal life, and do this job that he's giving me. I've been able to save up for my future. I now want to join the military, Navy branch, and working with him, it also opened up my eyes to entrepreneurship, starting my own business eventually, one day. And I just want to thank him for that. And I just want to say that without him, I wouldn't be able to, how can I say this? I wouldn't be able to see the successfulness of a black business. I wouldn't be able to see how a black man can come from nothing and make something of himself, to being the councilman of a city, to being a boss, to being a man that can employ other people and give them opportunity. I just see him as a role model, and I have multiple role models, but he is a very successful man, and I aspire to be someone like him by having my own, having a continuous income coming in, not have to worry about how I'm gonna eat, or if I ever have a family, how I'm gonna provide for my family. So I just want to say thank you to him, and thank you for this opportunity.
Michael Massey, 355 Crawford Street, Suite 704, Portsmouth, Virginia, representing Self regarding support for a resolution for LW Lawn Service.
Good evening, members of City Council, Mayor, Vice Mayor. It's an honor to be before you. I'm Michael Massey. With me is Attorney Nathan Chapman. we were employed by Mr. Williams to assist him in this matter. We are here tonight on behalf of the newly elected City Council member Leotis Williams and his business LW Lawn Service regarding the contract with the city of that the City of Suffolk entered into with Mr. Williams a year and a half prior to his election this past November. This evening, we are asking you to pass a resolution permitting Mr. Williams to complete the duration of his contract by specifically finding that it is in the public's best interest for LW Lawn Service to complete the natural end of its contract with the city. On May 1st, 2019, the City of Suffolk awarded contract 19061 to LW Lawn Service. This contract with LW Lawn Service was for 3 consecutive one-year terms. It is important to note that the contract was also endorsed by the city manager, attested by the city clerk, and approved by the city attorney, each of whom endorsed the contract. As you are obviously aware, on November 3rd, 2020, Mr. Leotis Williams was elected to the Suffolk City Council. Because Mr. Williams won the election, some people may be of the opinion that there may be some unsolvable conflict of interest. That is, in fact, not the case. Virginia Code Section 2.23107 defines what a conflict of interest is for a member of City Council. This code section also articulates the very specific exception to the conflict of interest in which Mr. Williams fits perfectly. Namely, the code section provides, in accordance with the Virginia Conflict of Interest Advisory Board, that personal interest of a city council member in a contract with city council is permissible under certain specific circumstances. It's a 4-pronged test. Simply put, 1, the contract must be awarded pursuant to a sealed competitive bidding process, and you all know that was the case. The governing body, the city council, must have had the need prior to Mr. Williams' election, and you all know certainly that's the case. Mr. Williams must have had no involvement in the city preparation of the specifications for the proposal, and indeed that's the case because he wasn't a member of city government. And fourthly, the awarding of the contract must be in the best interest of the public, that is, the people of Suffolk. Accordingly, no conflict of interest exists for Mr. Williams at this point. After some public discussion of the issue, Mr. Williams reached out to the Virginia Conflict of Interest Advisory Board, who through emails have confirmed that no conflict exists at this point. But due to the automatic renewal provision, out of an abundance of caution, the City Council should pass a resolution to confirm that the renewal of the contract remains in the best interest of the public. We recognize as a governing body, one of your primary concerns has always been the perception of the appearance of impropriety, the avoidance of conflict of interest, and the assurance against self-dealing. All of our ancestors arriving to America, whether from Africa via the Middle Passage or across the Atlantic Ocean from Europe or Asia or from the Southern Hemisphere in Latin America, all sought to be treated equally. And that's something that all of us seek as Americans. Suffolk government has a fine reputation of equality and fairness, which need not be compromised this evening. What is necessary is a fair and equitable resolution adopted by you all as the leaders of the city of Suffolk. It would certainly be a different case if Mr. Williams was trying to bid on a new contract. That's the conversation that I had with him. If he had sought to hire me to bid on a new case while he was on city council, that is something that I certainly would not have supported. He is not doing that. He's indicated to me and his other council that at no point while he is on city council will he seek to bid on a contract. That's important because you all can hold him to that. All he's doing is trying to complete a contract that was previously awarded to him. Mr. Williams has told you through his employees that they live in Suffolk. These are real lives. These are absolutely real families which will be directly affected if this contract is prematurely terminated. These families own homes, they rent homes in Suffolk, they buy groceries in Suffolk, they buy gas in Suffolk, they pay taxes in Suffolk. Keeping them employed is a prudent decision for the Suffolk City Council. This decision is about families. This decision is not about one man. It's about a group of families that rely upon him for their support. All of this said, permitting the 2019 contract to be renewed and to its end of its natural term, February 2022, would be the right, just, fair, and equitable and prudent thing to do. It was right to employ the lawn service in 2019. It is right to continue to employ them today. It is a wise financial decision. It is a prudent business decision, and it lets the citizens of Suffolk know that
Sir,
Suffolk...
I'm sorry, your time has expired. If you could wrap it up.
Yes, sir. The citizens of Suffolk know that the Suffolk City Council will remain a beacon of light for fundamental fairness. And one last statement, we simply need one of you as member of City Council to have the courage to make the motion, another to second the motion, and the remainder of you to say yes. And remember, saying yes to this resolution does not mean saying, yes, I support Mr. Williams. Saying yes in this resolution means I support this community and I support the families that live here and work here. Thank you.
Vanessa Harris, 685 Carolina Road, representing self regarding support of a resolution for LW lawn service.
Good afternoon. I'm here for Mr. L.W. Williams. Now, I've been in Suffolk all of my life, so L.W. is like a child to me. First of all, let's go back a little bit. Are the rules still the same, or have they been changed? From 1646, the name has been changed. It was Nansemond County. 1742, we went to Suffolk. Now, 1974, City of Suffolk. What rules have been changed? The road we travel and face each day is trying to help all mankind to make a way, to live, to work, and to be treated fair, to show our world we do care. Oh, the land of the free, and you are still mistreating me? A sentence rearranged in the game of life, but please listen, and listen well. This is not a fight. All we want is to live and be free, so don't play games with me. People just want the justice they deserve, not to be silenced or bruised by your words. Don't use me, then abuse me for things unknown. We are all in this together, and if you didn't know. So at the end of the day, may we all go home and rest, and each day go forth, we show we care. Let us help Lee Otis Williams keep his chair. Now, I do know that from the time I left high school, I have seen resolutions come and go and pass, and some of them didn't even have the right to be passed, but it happened. And you can do it too, if you want to. You can pass this for this young man. He's done a lot for Suffolk. And there's a lot of, nobody in this room can say, I haven't done anything wrong or didn't know, but somebody helped you. So it's time now for us to help Lee Otis. Thank you.
Jonathan Powell, 1118 Hoser Road, representing self regarding boat ramp in downtown, 25 years promise unfulfilled.
Sir, come this way, please.
Good evening, Honorable Mayor, Vice Mayor, council members, interim city manager, and city officials. My name is Jonathan Powell from 1118 Hoser Road. I bring this issue up to the council because there are three things that I believe my tax dollars should support. One, a boat ramp in the downtown corridor of the city of Suffolk. Two, the Main Street flooding issue during the times of storm. And three, the construction of a main public library here in downtown Suffolk. There's a need for these items, particularly from my posture in view. One, the boat ramp allowing access to the Nazarene River from the downtown area. With the adoption of the UDO and construction of the 3-star Suffolk Hilton Garden Hotel at 100 East Constant Road on 6 acres of prime Nazarene Riverfront property, in 2005, public access for launch and retrieval of boats or sporting equipment was removed, thus terminating access to the Nazarene River for free to this area. Brady's, their $15 ramp fee and dangerous launch and retrieval area does not offer the public the recreational access desired. There have been construction projects throughout the city, inclusive of a new city hall, new police headquarters and precincts, new fire stations, new schools, new city-owned school and public works facilities. But even with this construction, I still don't have a boat ramp in my city that I can access on the side of town that I live. A fishing pier has been upgraded in the heart of Bennett's Creek Park, along with the addition of 2 brand-new boat ramps and docks. A fishing pier and canoe kayak launch has been added at Sleepy Hole Park. A kayak launch has been added near the Hilton Garden Inn, but still, my 15-foot aluminum boat cannot gain access to the Nazarene River where I live. I have to travel 18.1 miles to the closest access to the Nazarene River and its adjoining waterways. In this time where we are experiencing educational resource limits, at this time when we include limited internet access and meeting room spaces, at this time where we see our students not having access to the necessary resource to continue to elevate their educational pursuits, we need this council, with the available funds for execution and commitment, to consider these projects in our city for our citizens. Thank you for your time.
Our final speaker this evening is George Mears, 4304 Ainsley Court, representing Self regarding conflicts of interest.
Mr. Mayor, Vice Mayor, members of council, city manager, whether during my career in the Navy or as an engineering consultant or as an engineer and a project manager of the Corps of Engineers, I had to deal with conflict of interest issues my entire 46 years of professional life. If you are an elected official, conflict of interest also applies if the public reasonably perceives impropriety is involved. And this has nothing to do with what other elected officials may have successfully gotten away with in the past. For example, many in the public deservedly don't trust Congress members to do the right thing because much of what they have done is so obviously corrupt or politically motivated that many no longer trust Congress. For example, a few years ago, the government didn't have to prove in court that a Congressman Jefferson took bribes simply because the FBI found wrapped up stacks of cash in Congressman's congressional office freezer. You may recall that this didn't get him removed because he wasn't a conservative. But this and many other instances on both sides of the aisles certainly had a lot to do with Congress' public approval rating dropping to 11%. And frankly, I'm surprised it's that high. So Suffolk elected officials shouldn't be striving to match Congress's lack of public trust. In this case, even if Otis' character was such that he could continue working on the city contracts but religiously recuse himself in every instance to have any influence whatsoever on the outcome of future bids, the public will still perceive him as being in a position to influence the outcome of those bids. And few in their right minds would fail to perceive a conflict of interest in such a situation. But let's accept, for the purpose of this discussion, that Mr. Williams is in fact an uncanonized saint. Other Suffolk City Council persons looking to enlist his support on future projects or proposals, could still end up using that to vote for Mr. Williams to keep his current contract and work to get him future city contracts. This would create yet additional conflicts of interest without any wrongful action on the part of Mr. Williams himself. For anyone even thinking about running for public office, such potential conflicts need to be avoided at all costs if one expects the public to continue to trust the system. The conflicts over prior city officials who accepted appointments to Town Bank Board of Directors, the financial speculation and deep developer links with council members and the city's Economic Development Commission, the occasional perceptions of a lack of value in Suffolk's partnership with the Hampton Roads Planning District Commission and Transportation Accountability Board have all tended to degrade this trust over time. But please understand that none of this has anything to do with racial politics. It's simply discussed with individuals in elected or appointed offices who too often take advantage of opportunities that completely aware and honorable public servants would have had the integrity and common sense to avoid. Even in instances where actions can't be proven to be improper or illegal, just the lack of transparency often leads to corrosion of public trust because of perceived, if not even legally actionable, conflicts of interest. This particular conflict of interest did not exist when Mr. Williams won his contract. The perception of a conflict of interest begins when he ran and won his city council seat. Whether or not actual conflict will exist when his contract comes up for renewal, the public will perceive that such a conflict does exist. Thank you.
That concludes the speakers, Mayor.
Thank you. Hearing no other non-agenda speakers, I will now move to new business. Madam Clerk, are there any additions to tonight's agenda?
The following individuals have been nominated for appointment to the Early Childhood Development Commission: Marie Baker as the Specialist in Child Development Representative, Gail Harrison and Carol Van Wilson as the at-large representatives, and Tammy Rittenhouse as the Medical Services Representative.
Motion's in order. Councilman Goldberg, first. Second, Councilman Johnson. Madam Clerk, please call the roll.
Councilmember Fawcett?
Yes.
Councilmember Goldberg?
Yes.
Councilmember Johnson?
Yes.
Councilmember Ward?
Yes.
Councilmember Williams?
Yes.
Vice Mayor Bennett?
Yes.
Mayor Duman?
Yes.
The motion is approved by a vote of 7-0.
Are there any new business items that require the action of City Council? Councilman Fawcett?
Yes.
Councilman Fawcett, let him do it.
Yes, thank you, Mayor, I appreciate it. I'd like to take this opportunity to make a motion to appoint Shirley S. Butler Barlow to the remaining term of the Chuckatuck Borough, which ends December 31st of 2022.
Second?
Second.
Second from Councilman Johnson. Any discussion of the motion? Hearing none. Madam Clerk, please call the roll.
Councilmember Fawcett?
Yes.
Councilmember Goldberg?
Yes.
Councilmember Johnson?
Yes.
Councilmember Ward?
Yes.
Councilmember Williams?
Yes.
Vice Mayor Bennett?
Yes.
Mayor Duman?
Yes.
The motion is approved by a vote of 7-0.
Is there any other new business items that require council action of City Council for consideration? Councilman Ward?
Yes. Okay, I move that the city attorney drafted a resolution for consideration at the February 17, 2021 City Council meeting that state that it is in the public interest that Councilman Leotis Williams submit a bid in the competitive seal bidding process for the city contract for landscaping service for the city-owned building.
A motion has been presented. Do I hear a second? Hearing none, I'm going to pass the gavel to Vice Mayor to chair the motion.
There's been a motion and a second on the floor.
That being done, I'll second Councilman Ward's motion.
It's been properly moved in second on the resolution as read. There any discussion of the motion?
I'll start.
Councilman Johnson.
Leotis, people like you. It's pretty obvious you're a pretty great fellow. 6 years ago, when I chose to run for council, I knew that when I was elected that I was going to have to make a lots of sacrifices. My family, my friends, work, and we all make those sacrifices. But what I didn't realize at the time was that I would also lose business. I caught on pretty quickly that I lost a considerable amount of city business. I had a good business with the city. I didn't like it. I kind of talked about it a little bit at first, and then I read the Code of Virginia, and I realized that I was wrong and that it's just the way it has to be. We represent not only our city, our citizens, but its future. What we are being asked to consider is foreign to me because I would never have considered this something that I could vote in favor of. I'm concerned that this request may be viewed as an impropriety for our citizens. We would be insinuating that appropriate fulfillment of a contract, even for a number of years, is reason enough to allow that contract for an elected official. I'm not prepared to say that this is the right thing to do at this time. This action could potentially place a huge burden not only on us, on our citizens, on our employees, and leave a huge question of impropriety. This is not racial. Leotis, we don't do racial. One of your men came up, and my goodness, wasn't it wonderful when he said, Suffolk is not like a lot of places in the nation. We're not. We treat our citizens all with the same respect, and we view each other as family and brothers, and I feel that way, guys. But it's not racial. It kind of bothers me that people will insinuate that it is. All of us have made the choice to run for council. When you do that, you accept the Code of Virginia, which says no person elected or appointed as a member of the governing body of a county, city, or town shall have a personal interest in any contract with that governing body. Now, then it goes on to say there is a provision that we can do a little addendum down here and have a resolution that states it is in the public interest for the member to bid on a contract with the city. You've been nothing but a wonderful employee to the city. I've heard that from everybody that you've worked with here. But for us to sit here and state that it's in this city and public's interest to let you continue with that contract, if there were no one else to do the contract, if you were a nuclear physicist and we couldn't find another soul, I'd say fine. But there are others that can bid on this contract and hopefully do a good job. Or that young man that came in that works with you, my goodness, he's the one that should be bidding on this contract with somebody's help. But I honestly believe that when we sit in this position, and this has nothing to do with anything other than I honestly think it's the right thing to do, that it is a sense of impropriety for the citizens of our city. And you're a great fellow, these are great people, and I support the community. Another one of you guys said we need to do what's right. My problem is, I would love to say keep the damn contract, who cares? It's great, you're doing a good job. But it's not right. It's not right for our citizens, in my opinion. So that's all I can say. I have to do what I deem right for our citizens. And I see too many implications, too many things that can happen down the road for me to say that this is in the best interest of our city, of all of our city. I'm not sure it is. And for that reason, I can't support it. And I'm sorry, because we're going to be working together for the next 4 years, and 2 years for me, maybe, whatever. But I'm sorry. This is not a good way to start off, but I cannot support it. I'm sorry.
The other? Councilman, Mayor Duman.
Thank you, Vice Mayor. I seconded Councilman Ward's motion for several reasons. One, it allows us to discuss what other people have been discussing for several days. I'm not pleased with how we got to this juncture, but fact remains we have. So I want to take a brief moment to be specific and provide full transparency to explain the process that brought us to this point. Hopefully with a full understanding of this situation, certain assumptions, innuendos, and insinuations will be squelched. I'd like to start from the beginning when I was advised that certain contracts Council Williams had with the city could be construed as a conflict of interest. The city attorney researched the issue and in addition was given a copy of an opinion provided to Mr. Williams' attorney from the Virginia Conflict of Interest and Ethics Council. The opinion offered by the Virginia Conflict of Interest and Ethics Council advised that pursuant to Virginia Code 2.2-3107, paragraph B, paragraph 3, the personal interest of a city council member in a contract was allowed for an existing contract only. Any renewal or opportunity to bid on future contracts would only be allowed when the contract is awarded, and I quote, as a result of a competitive sealed bidding where the governing body established a need for the same or substantially similar goods through purchases prior to the election or appointment of the member to serve on the governing body. However, the member shall have no involvement in the preparation of the specifications for such contract, and the remaining members of the governing body, by written resolution, shall state that it is in the public interest for the member to bid on such contract. The opinion went on to state, and I quote, the members of the City Council will need to pass a written resolution that is or was in the best interest of the public for Mr. Williams to bid on these contracts. This resolution does not need to be passed for the contracts as they currently stand, but should be done when the contracts come up for renewal. I think part of what is not being understood is the original contract is the original set contract plus the renewal periods that a gentleman alluded to earlier, and that renewal process requires a resolution from council. Or if Mr. Williams were to bid on another contract, it would require a resolution from council. Those formal opinions, the code and the opinion of the Virginia Conflict of Interest and Ethics Council guided future action by myself, the city staff, and council members. Once it was determined a resolution by council would be necessary to grant the renewal of his existing contract or the ability to bid on future contracts, I proceeded to poll members of council to gain consensus. This consensus would determine how to move forward. There was not adequate support for the first option of allowing renewal of the original contract. I then presented the second option, which would allow Councilman Williams to rebid his contract, with the thought being it would be in the best interest of the public. There was no additional support for the second option. During the entire process, I kept the council and Councilman Williams informed. The reason stated to me by those in opposition to a resolution was that it would present an overwhelming appearance of impropriety if granted, and therefore was unacceptable. It should be noted that the reasoning of the majority was contrary to my opinion and another council member. I made my opinion clear to each council member. I do want to take the time to state unequivocally that as I polled council members, I did not detect any malice, ulterior motive, or prejudice that influenced their decision, and each member is entitled to their opinion. The public needs to know that the process followed to address was done strictly in accordance with Virginia Code and the Virginia Conflict of Interest and Ethics Advisory Council. As mayor, I am willing and dedicated to ensure that any options available to Councilman Williams or this council are afforded.
Are there any other councilman?
Go ahead, Tony. You want to go ahead? Go ahead. I'll come in on the back.
Doesn't matter. Thank you. Thank you, Mr. Mayor. Thank you for the time to speak on this ethical issue. I think we've heard some talks tonight. I think some points have been missed on this, and I want to bring a few things out. There was a press conference last week in which I and other members of the City Council were called by name in dealing with Councilman Williams' conflict of interest issue. In my opinion, I and the other members of the council were slandered with vicious and improper statements, all inferring that we were opposed to Mr. Williams because he was an African-American businessman who won a council seat in November. Nothing could be further from the truth. This situation was not created by this council. I and the other council members congratulated Mr. Williams upon his victory and welcomed him on council. Mr. Williams has known for years that having contracts with the city would put him in jeopardy if he was elected to city council. It was his decision to run for office, and this action put Mr. Williams and his employees in jeopardy because of the conflict of interest. Let's be clear. It was his decision to run for council seat or retain his business contracts with the city. I also would like to point out that Mr. Williams and I have never had a conversation on this issue. He said he would like to call me, but never did. I assured him that I'd be willing to speak with him, but the call never came. Mr. Williams made a choice. His choice was to run for city council. The mayor called and asked my opinion, just like he just stated, on the contract. I assured him that this is how Mr. Williams became aware of my position, and the conflict of interest issues are a major ethical concern when one serves on city council. The mayor further asked me about the contract and the possibilities that I would be in support of a resolution that all council members would sign to allow Mr. Williams to bid on the contract. I replied in my opinion that I could not support such a resolution, for it created a conflict of interest in which a sitting councilman would have a contract of service with the city. The general public's perception would be that we are giving one of our own an inside and sweetheart deal. I cannot and will not be a part of something of that nature. Again, I cannot make my position any stronger. A sitting councilman must make every effort to being above board when dealing with conflicts of interest issue. I believe that Mr. Williams and his supporters have put the city council in a very unfair and difficult position. Whereas all of us support Mr. Williams' right to run for public office, he is the one who made the decision between keeping his contract or running for city council. I took an oath to serve this community to the best of my ability. I believe my position is quite clear in my service to our citizens. Let me repeat so that everyone understands, in contrast to what many of Mr. Williams' supporters proclaimed, this council members congratulated him on his election to city council. We look forward to serving with him. But this conflict was created by Mr. Williams in his decision to sacrifice his contracts so that he could serve on city council. In conclusion, I understood minority issues all my life. I myself am a minority and am quite sensitive to those issues. However, this is not one of those issues. It is strictly an ethical issue dealing with a contract providing services to the city in which the city councilman has that contract. In the past, other council members have given up contracts when they have become elected to city council. This situation is no different. Not even a special resolution changes that dynamic. It is and will always be a conflict of interest. I continue to have a problem with name-calling and slanderous comments. I strongly feel that at a minimum, this council is owed an apology. I appreciate my time. Thank you very much.
Thank you, Councilman Roger Fawcett.
Thank you very much, Vice Mayor. First off, I want to start off and say Tim Johnson and Donnie Goldberg, you could not have framed this and made it and sounded any better than you did. And, you know, I want to just say a couple of things here, and I'm not going to drag this because you all have done a fantastic job stating the position, and I support you both, your writings that you just presented tonight. You know, my son and I were in business for 18 years in the same, almost the same type of business that Mr. Williams was in. And when I came on this council in 2012, my son and I, in a conference room, sat down and made the ultimate decision that we would never, as long as I was an appointed, elected official, that we would ever enter into any city contracts, just to keep it straight from looking like a conflict of interest. We could have came in here and blown these contracts up the size of the company we have today, but we've stayed clear of it, just so we wouldn't have our hands in it. Because the first thing you hear around when you start doing things such as appointing or giving a resolution is, y'all are doing backroom deals again. I've heard this since I've been on council since 2012. Every time we meet, we're doing backroom deals. And it's furthest from the truth. Everyone on this dais that's been up here with me, with the exception of Mr. Williams, has never done something of that nature. On Thursday, last week, I viewed that conference that was aired out on Facebook Live. And I am truly and sadly appalled by the conduct of a sitting council member. You can't say, well, I'm not here today representing a council member, I'm here representing my business. And I appreciate business. I appreciate everybody that's in business. Everybody out here is trying to do their best to do everything. But you don't get to choose what day of the week you want to be a council member. You took the oath up here, and you're a council member 24/7, 365 until you're into your term, or whether you decide to be here or not. And I'll tell you, I personally feel attacked because you never sat down and talked to me after you told me, walking right by me in the last council meeting, that you wanted to talk to me about something, but you never sat down and talked to me personally. You let the mayor talk to me, which he did, and I have no problem with that. But in my opinion, you should have pulled your pants up and you should have went ahead and talked to everybody yourself. But to take my integrity and drag it through the mud in front of two news meteors is the poorest conduct that I've ever seen. And that's not the way we've governed on this dais. Obviously, you didn't get informed properly. And as some of these folks have said, you knew right well coming into this council that you were going to possibly have a problem with these contracts. You were well informed, and you made statements that someone told you was going to be no problem, which whoever was at was giving you the wrong information. You went to the city attorney's office and asked for her to give you a decision, which he referred you to a private attorney to make it because you weren't a council member. And I read the same thing, that part of what Councilman Johnson had stated. And, you know, it's pretty clear to me. But the most important thing is here, you or me or anybody else, and it wouldn't have mattered if it was anyone on this dais, and if somebody else has a contract in this city that's sitting on this dais, needs to take a good look at it, because you ought to not be involved in it, just for the perception to the public and to let the public know. And I'm not saying you're not doing things in the best interest of the public, but you're not doing anything that any other contractor can't do. And I look at the other contractors that I'm in connection with that have contacted me since this is broke on the Channel 10 News, that this city better take a good, strong look at resolutions, because what they do for you, why can't they have it? So therefore, there is a very, very big problem with this. I will never, ever support someone on this dais on a resolution to take and do business where you govern in this city. Never. And I am with Mr. Goldberg. This is not a racial issue. And I think in some cases that may be boundaries where it might have went. And you need to come in front of the public and say that it was not a racial motivated thing, and it was not, and you owe us an apology as individuals who you named, and you owe this council an apology for making us look bad in the news, and you owe this city of Suffolk that you wanted to represent an apology. That's what you need to do. Stand up and take the ownership of it. Until then, it's not going to be favorable. And I hope in the future, when you sit here and govern, you think real hard about how you want to put a council member's name on the floor or in the news or put us out there in harm's way. Just as much as they're our families as they were you trying to do for your families. My family doesn't appreciate it. And I don't tolerate that kind of action. It's inappropriate. Now, I had made an opportunity in my mind to ask a couple of things of you tonight. I could have censored you by law for your conduct and behavior, or I could have just asked you for a resignation. But I'm going to wait on that and see how this thing goes. But don't ever use my name again. You didn't come and talk to me about it before you do it. Or nor anybody else on this council use my name that I don't know about. Because it won't come out pretty, because I'll put it right here where the public is viewing this. Thank you, Vice Mayor.
Any other comments?
Yes,
Councilman Ward.
I'd like to speak. Just want to say a couple of things. I just want to say that I had no intentions of these remarks. When I find out what was going on and to hear or to know how the mayor wanted to just to possibility to see can he get the votes for the resolution. And after I talked with the mayor a few times, I understood something. I was talking to Councilman Leotis Williams, and it took me to ask for a resolution in order for Councilman Williams, just for he or the people could see who voted against the bid or the job he had. All he wanted was come and allow the council to say what y'all saying tonight. And this is before the press conference. Sometimes it's bad, somebody got to do something else to get justice for him. And that's all he wanted to say. That's all the mayor tried to get us to understand. And the mayor said he went everywhere and couldn't get a yes but me. So I said yes to anything that possibility that I felt was justice for the man named Leotis Williams, councilman. And I sit here and listen to a few of y'all, and one thing I do, I listen, and I might don't come off as well as some of the people be talking, but I do listen. And the only thing Councilman Williams wanted for 3 weeks, for you can come up and say what you're saying now. And the press conference was a week, maybe a couple of days ago. And it took me to come tonight because it wasn't on the agenda and it wasn't going to be on the agenda. So all he wanted was to see you say what you're saying now. And for some of y'all to say, out your mouth, you have said things about me. You had said something about Mr. Williams. Don't come here trying to bash Mr. Williams when you done said something out your mouth against me.
Mayor, he's making a direct comment to me. I'd call for a comment.
I didn't call no names.
Point of order.
Did I call any names? You called names. You talked to Mr. You talked to Mr.
Point of
Williams.
order.
And you talked to Mr. Williams.
Mayor, Vice Mayor.
All right, I call a point of order. We will not call names. We will stay to the point, but not call names.
Not
Mr. Vice Mayor, did you hear me call anybody name?
I wasn't really.
No, you got to listen now. You got this gobble. So
I know,
for you to make that statement, did you hear me call anybody name? I called the mayor.
Yes,
I didn't call Mike Doom, I said the mayor.
I heard that.
Did I call anybody else's name?
Okay.
Excuse me?
I don't know. Continue on.
Well, okay then, don't say, I ain't called nobody's name.
Well, you say.
But you're guilty, you must be guilty if you're gonna say I'm talking to you.
Who you talking?
I'm not talking to you, I'm talking about somebody who said, out of order, I said somebody's name, that's what I'm saying. Okay, let me finish what I gotta finish. Well, like you said, that's what was the biggest problem with me, and a couple other problems. That people made statements, and sometimes you gotta watch what you say. They made statements. Because a man bid for a bid, and his bid is low, that means he did the right thing. You can't fault him for bidding when you got 21 other companies bidding. Statements come back to bite you. And you make statements on this dais that is not true. I wasn't going to say anything, but when you're telling something direct, you need an apology. I think we might have to give him an apology from the first beginning, how we treated him about this. We could have been talked. We could have been talked about this. This is not something we had to talk open. And Mr. Williams probably would have sit and listened. But all he wanted to vote. That's all he asked for. That's all he asked for. That's all he asked me, he wanted to vote. So he had to have a press conference to get a vote. Then I had to say what I had to say for a resolution to get a vote. No, he didn't want this being kicked under the cover no more.
Call for the question.
Well, here we go again.
Call for
I don't think you ran for mayor.
I'm gonna let him finish.
I don't think you ran for mayor. You might want to be mayor, but you didn't run for mayor. And my other friend,
Councilman Ward.
we do have races, but we got to work at it. We got racial problems. We do. We just got to work at it. That's all. I wouldn't say we were all of us racist up here. No, I wouldn't say that. Like I said, I wouldn't even say that decision y'all made was racist. I wouldn't say that neither. But it just happened to have a black person that owned it. And just like you said, that's how it looked. Just like Mr. Williams, that's how it looked at him also about the bid. Thank you.
There's a motion on the floor, and just before I call for the motion, I'm not going over all this other stuff that's been said, but I'm sitting here tonight as a person that will carry the motion, and as I stated to the mayor and I stated to Mr. Williams about this issue, that I didn't say I was going to vote for, against, or anything else. But it bothered me to a point when somebody used my name and say that I had voted against the issue that I had not, then that is something that I do not appreciate. If I said it, then I said it. But that was not what I said. I told him I had a concern with the resolution. That's what I told Mr. Williams. That's what I told the mayor. I did not tell him, either one of you, that I was going to vote against it And I did not tell either one of you that I was voting for it. Now, did I? Right? Yeah.
Call for the vote.
I didn't tell you that I was voting for or against, did I?
That's correct. When I polled all the council members, your statement was, I have serious concerns, but I haven't decided.
Right, thank you. Mr. Williams, did I tell you that I was voting for or against?
There's a motion on the floor. I think you need to complete that motion, sir. And then when I have my chance to make comments, I will comment.
Okay. There's a motion on the floor. Call the roll.
Councilmember Fawcett?
No.
Councilmember Goldberg?
No.
Councilmember Johnson?
No.
Councilmember Ward?
Yes.
Vice Mayor Bennett?
And I'm abstaining.
Mayor Duman?
Yes.
Thank you. The motion fails by a vote of 2 to 3 with Councilmember Fawcett, Councilmember Goldberg, and Councilmember Johnson voting in opposition.
Hey, gavel back. Gavel back. Okay, do we have any other new business items that require to ask the city council for consideration? Hearing none, we will move to announcements and comments, and at this time, we will ask everybody's favorite, the Media and Communication Relations Assistant Director, Tim Kelly, for any announcements.
Good evening, Mayor, Vice Mayor, City Council, City Manager. Before I get to my announcements, we have gotten some news from the Western Tidewater Health District that I think will be of definite interest to everybody. They've announced that they're holding a vaccine event, includes 1,000 doses of the Moderna COVID-19 vaccine. It'll be available to residents ages 65 and older of any locality in the Western Tidewater Health District. Now, this will be held on Wednesday, February the 10th, from 9 a.m. to 6 p.m., until all the doses are gone, and it'll be by appointment only. The event will be held at East End Baptist Church, located at 1056 Portsmouth Boulevard. And you ask, well, how do you get the appointment? Okay, you have to call your local health department to make that appointment beginning tomorrow, Thursday, February 4th. I'll repeat all this so we can get all the facts and figures. But again, the number to call, which is probably the most important thing here, is again 757-514-4781, and that is the Suffolk Health Department number. So again, 1,000 doses of the Moderna COVID-19 vaccine available to residents age 65 and older of any locality in the Western Tidewater Health District. This event will be held Wednesday, February the 10th, from 9 a.m. to 6 p.m. until all the doses are gone. Again, it's by appointment only. This will be at East End Baptist Church, 1056 Portsmouth Boulevard. And again, you call for those appointments starting tomorrow, Thursday, February the 4th. So I just want to make sure we got that information out. We just received that information within the last hour. So I want to make sure I led off with that, given your earlier discussion during the council meeting. So I just want to get that out there first and foremost. So moving on to some other items here. Tonight we have news on a number of upcoming events and program offerings, but we lead off with news on the deadline extension of the second HRUB's Utility Bill Pandemic Relief Program. Now, this program provides financial assistance to qualifying City of Suffolk residential and non-residential utilities customers who are experiencing financial hardship due to employment impacts caused by the COVID-19 pandemic. The program is supported by the CARES Act and allows the Suffolk Department of Public Utilities to provide this assistance through a statewide municipal utility relief fund. Residential and non-residential customers with delinquent water and wastewater utility bill charges from March 1st of 2020 to November 30th of 2021 are encouraged to apply for assistance with the program. The city will provide assistance to qualifying residents and businesses, again, with those COVID-related past due balances until November 30th of this year, or until that funding runs out. Applicants can verbally apply by phone by answering some brief questions, or they can submit a short online application. Suffolk Police Department believes the citizens of Suffolk should be free from fear of crime and be comfortable in their neighborhoods. Policing efforts are geared toward eradicating crime and removing such fear. The only way for Suffolk Police to know your level of fear, if any, is to have citizen feedback. Suffolk Police Department is requesting citizen input in the form of an online survey. This will be up in place through February 28th. The survey will help the department recognize its strengths and weaknesses through constructive citizen comments to be used to gauge how it's doing. Now, additionally, the survey will ask if you had any contact with a member of the police department in the past year. If you have, it's asked, but not required, that you provide feedback on that contact. The link to the survey can be found on the Suffolk Police Department homepage. If you do not have a computer or access to a computer, you can also pick up a copy of the survey from any Suffolk Police Department building. Keep Suffolk Beautiful, hosting a recycling drive on Saturday, February 20th in the parking lot at Ansem River High School. The event is from 10 a.m. to 1 p.m. and is for Suffolk residents only. The Suffolk Sheriff's Office will be there as well. They're encouraging residents to take advantage of secure document shredding to help protect against identity theft. This is also the perfect opportunity to safely dispose of personal documents while cleaning out your files for tax season. Now, as far as the recycling part of the event, you can recycle things such as electronics, gently used clothing, batteries, plastic bottles and jugs, plastic bags, and glass containers, along with other items, as well as household hazardous waste. In recognition of Black History Month, the Suffolk Public Library will be celebrating Black history, achievements, and overall excellence with a variety of virtual programs and contests for all ages. You can visit the Suffolk Public Library website or follow them on social media for event listings and updates. Join Suffolk Tourism in partnership with the Suffolk Center for Cultural Arts. They'll present From Stage to Screen, a series of former Broadway masterpieces that found huge success on the big screen. Dreamgirls, the second in the series, will be shown Thursday, February 11th. Admission is $3 per person. The movie begins at 7. You can get tickets at the Suffolk Center for Cultural Arts box office or visit them online at suffolkcenter.org. Join Suffolk Parks and Rec on Saturday, February 13th from 7 a.m. to 9 a.m. at the former site of the Driver Naval Radio Transmitting Facility. That's 3901 Sleepy Hole Road. You can scope out birds found in our area at the Great Backyard Bird Count. No cost to attend. Advanced registration is required. You can do that online or at the East Suffolk Recreation Center or Whaleyville Recreation Center. Suffolk Parks and Rec is also looking to play ball this spring with several sports offerings. There's an adult co-ed spring softball league that runs from April to early June. Registration begins Wednesday, February 17th, ends on Friday, March the 26th. Registration for the Spring Youth Outdoor Soccer League for boys and girls ages 4 to 13 is underway. That runs through March the 5th. And Spring Youth T-Ball registration, also ongoing through March 5th for players ages 4 to 7. For more information on any of these leagues, you can contact the Parks and Rec Athletic Division at 514-7270. And in observance of President's Day holiday, Suffolk City offices will be closed Monday, February the 15th. Trash and recycling collection will run as normally scheduled for the period of February 16th to the 19th, so again, no change in that trash and recycling collection during that particular week. And again, we leave you with the ways we reach out to our residents and business owners. The number in the upper left-hand portion of your screen, 514-4000. If you need to get connected with city services, you have questions, we have staff there to help. With that, say good night.
Thank you.
Yes, sir.
We'll now move on to announcements and comments from City Council. Councilman Johnson.
I feel like I always get picked on being on the end. Wait till we get somebody else down here.
That works better.
I'm going to be really brief. I've talked out this week. It's been one of those weeks. But I do want to say we are so blessed to have Randa. I'm so pleased with the broadband news, and I know the people of Holy Neck will be pleased. And time frame, let's push. We need it yesterday, not tomorrow. To the citizens of the city, we're a good council. We work well together despite what you see tonight, but we like each other. We're going to continue to get along, and we have a huge city, but we all have to do what we deem is the right thing to do. And I know right is different in everybody's mind, but you elected us to be up here to do right as we perceive it. Now, when we're not right, keep telling us, we'll catch on to your right, but I'm sorry, this is how it works. We have a wonderful group of men up here. And tonight, a new woman coming in to join us, which is wonderful as well. And we respect each other 100%, and we're going to move forward in that manner, I hope. And that being said, I'll say goodnight.
Well, there's probably been more said tonight than needs to be, but first off, I'd like to give a shout out to Dr. L.D. Britt. He was on Wavy TV last night, and they gave a great piece on him, Black History Month, and I thought they did a great job. Like the news reporter said, there wasn't enough hours in the day to talk about all the great things that man has done in this country, not just in the city of Suffolk. So, Dr. Britt, you're still awesome, and you're still Suffolkian. So, also, I go along with what Mr. Johnson said. Randy did a great job tonight. Looks like Al, she's pushing and helping us, and she really spoke well tonight, and appreciate her coming down and giving us the update. Last Saturday, I had an opportunity to go out to the Nasmith Reserve, which is the new development on Sleepy Hole Road. Of course, Ben Davenport and his dad are the developers of that property, but they are just going storm out there. They have probably close to 40 properties now that are have actually people purchasing them. So it's a matter of getting the buildings built. So I had a chance to go out because Scott Taylor took the opportunity to have his own ribbon cutting, and he had the first family that purchased the first lot that's building a house out there that I thought was really pretty cool. Although I told him he's going to have to extend the door height because the fellow that is purchasing it pretty much got to duck a little bit to get in. But that's going to be a great place. And I recently was informed by Ben Davenport that we have an issue with the light being constructed. I think the city manager and us have talked about this at Sleepy Hole and Bennett's Pasture Road. But he called me the other day and gave me an update that he has now a tracking number, and the materials for the light will be in here in the next few weeks, and he hopes to have that light operational by the middle or no later than the middle of March. So for all those folks out in the Sleepy Hole area that's waiting for that light, it's on its way. So I thought that was good news. I want to thank all the speakers that came up tonight, whether they were speaking about Bridlewood or the speakers that came up about the resolution. Thank you for coming out and sharing your comments. With that, I'm going to go ahead and say goodnight.
Thank you, Mayor. First, I have prepared some notes. So what I'm going to do, I'm going to read what I had prepared. And then I want to talk about some of the comments that were made. So let me read what I had already prepared. I would like to first of all thank my many supporters and the speakers that came out in support of my employees, LW Lawn Service, and I. I appreciate the love that you have shown us during this ordeal, and I realize something. Only when it's dark enough can you see the stars. For the sake of transparency and to ensure that I was following the laws of the Commonwealth of Virginia, I received an opinion from the Virginia Conflict of Interest and Ethics Advisory Council. I was not, and I am not, asking anyone for any favors or to break any laws as it relates to LW Lawn Service contracts. I just wanted council to pass the resolution per the guidelines set forth in the opinion of Virginia Conflict of Interest and Ethics Advisory Council. I'm only asking that everyone be treated fairly across the board. Equality is what's important. Rumor has it that I am considering vacating my city council seat because of the financial hardship that could occur if I continue to serve on city council. Please allow me to put that rumor to rest. I am not, and I will not give up my council seat. I ran for city council because I wanted to make a difference in my community and this great city. And I am planning on being the best councilman that I can be for my constituencies. Equality. That's all. That's all I was asking. To be treated fairly. I got an opinion. I passed that information on, and I was only looking for you guys to do just that. Follow the guidelines of the opinion of the council. I've been talking to the mayor for over 3 weeks. I just want an up or down vote. That's all. A up or down vote. That's it. That's all I wanted. A up or down vote. I got it tonight. I got a mouthful. Mr. Fawcett. Councilman Fawcett. Councilman, don't you ever disrespect me like that again. I'm a grown man. Don't you?
Councilman Williams, no personal attacks, please.
I'm a grown man.
Two rights don't make a wrong.
I'm a grown man. I would never talk to anyone on this council in that tone. I don't even talk to my kids like that. I don't even talk to my grandkids like that. So if anyone owes anyone an apology, it's you. It's you. But, you know, I was here. I was elected for 4 years to serve my borough. And I plan to do that. There are going to be some times when you're going to need me to side with you on some things to get done. And there's going to be some times where I'm going to need your support as well. See, I'm not going to take this personal. Because in the business world, business is just that, business. And this is business. I don't have time to deal with personal problems and personal issues and harbor things inside me. That's not me. That's not my makeup. Some council members said that I didn't talk to them. Some council members said that I spoke with them. And they said, oh, my mind is not made up. That's a lie, whoever that councilman was. Whoever that councilman was, because I'm not mentioning names, but y'all want to call me out. But it's okay. It's okay. We're going to be all right. I'm here to work with you guys, and it's okay. But stop taking everything so personal. True, we had a press conference. True that because of the press conference, we got a chance to put it out there, up or down. Something that I've been asking for 3 weeks, a up or down vote. That's it. That's all I asked. Was that asking too much? Obviously so, because nobody was hearing it. It wouldn't happen. Some council members said that I threw the names out there. Well, let me say this. I'm responsible for my employees. I'm responsible for what my team says. So, okay. Okay. Whether it actually came out of my mouth or not, the point is I am responsible for those people around me. So I accept that responsibility. But again, let me assure you, I'm not going anywhere. And I'm going to serve my term. And I'm going to do what I have to do to provide leadership to those in my borough that supported me. Before I close, I would like to offer my condolences to the family of Mr. Donald Bennett, the city of Suffolk former housing official. My heart and prayers go out to his family. I believe in transparency. I was elected on just that, being transparent. So with that said, if you don't want something repeated, if you don't want something repeated other than what's going on in closed session, don't say it. Don't say it. I'm not one of the other council members that was here prior to me sitting in this spot. It's a new day. And I'm not going to sit back and allow anyone to talk to me like I'm a child. With that, good night.
Over. Thank you, Mayor. I'll be brief. I really thank Randa and the city manager and appreciate you on doing with the internet. I think it's very vital for our kids. I wish it would be sooner than later, but the fact is that we're on the right track, and I do appreciate that effort in getting the money there needed. And I think overall that will help the budget that we have to come up with and how we handle that. I also have some condolences. One of our citizens here, a gentleman by the name of Robert Gillette, he'd been an attorney in Suffolk for many, many years, and many people went to him for practices and so on. His older brother passed away. Recently, he was an officer, and he passed away at 84. Bob, of course, was very close to him, and I just want to give my condolences to the Gillette family for that. And with that, Mayor, I'm not going to acerbate any more of the conversation or answers and any more of the other things that we've had tonight. I'm going to just say good night.
Okay, thank you. Councilman Ward.
Yes, tonight we had a joint board meeting with the school board, and it went quite well. I learned a lot of things that I didn't know about and what direction they want to go. I think Superintendent Gordon have a good plan along with the school board, seeming as though they want to take the Suffolk school system to another level, and hopefully the city council and the school board, we can work on that together. It's all about the students. I also want to say God bless. Thank you.
Vice Mayor.
Thank you, Mayor. Well, I think that we had Dr.
James?
Dr. Jane with us tonight, and I think she really gave us a lot of information. I had told a lot of people to tune in because she was going to be here to give me information on about the health department and the vaccine and all that. So I'm hoping that people were tuned in and was able to get the information so they will know exactly how to contact the health department, and also with the 1,000 vaccines that will be available on the 10th at East End Baptist Church from 9 a.m. until 6 p.m. So I'm hoping that, I guarantee you tomorrow morning, that 1,000 will be gone probably about less than an hour. Just time to hear about it. I'm sure that that will be filled up. So again, I wanted to thank her, and I meant that. I felt very sorry for her that the situation that she was put in after Dr. Wagner left. She came in and had to just really take it over, and with the health department being closed, a lot of people didn't understand that. So I was glad that that was able to be explained, and it was getting ready to open back up. And I didn't realize it was only open 2 days a week until she said it. I thought it was open every day. So that was something new to me, knowing that it was just open 2 days a week. I thought it was open every day. So one day is better than none. So I'm glad to see that being able to open back up and we can move forward with that. Donald Bennett was a dear friend of mine, and I will definitely miss him. When I got a call back in November, I believe it was, that he was out sick, it really bothered me because he's an ex-Navy guy as well, and he and I had a lot in common talking about different things, and he's a good person in the community, and a lot of people really respected him, and I just offer my condolences to his family, because I was thinking, I didn't know it was Danville until I read it in the paper. I thought he was local. But anyway, I wish to swear in that I would be able to attend the graveside, but Roanoke is a little distant, so I know I would not go out there to that, so I'll have to try to get some, if you can get the address, I'd like to send them a card or something of condolences. And with that, I am a person that believe in honesty and integrity, and I have no reason to lie about anything that I say, so I'll leave it at that. So with that, I would say good evening.
Mayor, just a few comments. Let me start with some good news. I want to congratulate Ms. Barlow on the appointment to fill my seat on City Council. I also want to welcome Mr. Billy Butt to our city. Thank you. Looking forward to a long relationship and what you're going to be able to do for our assessor's office. I also want to offer condolences to Mr. Donald Bennett's family. I got to know him quite well, probably 15, 20 years ago on several issues in his department of community development. And I know he was very responsive to a lot of the citizens in Chuckatuck when they had issues. As a matter of fact, they were looking for him the other day. They hadn't realized that he had retired a couple months ago. Roosevelt Jones was looking for him. I'm going to call Donald Bennett. Well, Donald Bennett went home, and it's in my deepest condolences to his family. Also, the family of Mr. Mickey Boyette, who served on our Historic Landmark Commission and was one of the proprietors, the First Lady. I understand that he passed away the other day. My condolences to his family. Back to some good news. The 1,000 doses of vaccine that will be available on February 10th. I thank East End Baptist for offering up their facilities. You need to call between 9 and 6 and schedule your appointment. It's a step in the right direction. I mentioned earlier when Dr. James is here, we as a city, we as a council, we as a city administration are listening to your concerns, and we are doing what we can. And we are going to continue to work in the right direction. And we will continue to make noise when we have to ensure that our citizens are getting the best service they possibly can. I want to remind everyone that there's a police crime and citizen contact survey on the website right now, I believe through October 28th. The survey will help the department recognize its strengths and weaknesses through constructive citizen comments to be used to gauge how it was doing. I mean, we are blessed with one of the best law enforcement agencies in the country as far as I'm concerned. And the time that they have taken to engage our citizens and earn that mutual respect, this is another way of doing that. We want your information, please put it out there. In regards to first responders, last week we had 3 firefighters that I believe had to go to the hospital because while they were doing their job, a wall or something had fallen on it. So, you know, it just reminds us all the time that our first responders put themselves in harm's way all the time. So fortunately, they're all fine. As far as I know, everybody's back on the job. Great news today on the internet. You know, being able to get some internet access on some dollars that are already allocated to help some of our rural areas. You know, there are a lot of good things going on right now, really, really good things. Another really, really good thing was our school board joint meeting today and getting the results back from the school facilities study that also talked about rezoning options. is excellent. I mean, I was actually excited when I read it because there were several good ideas. I mean, great ideas, and there's some low-hanging fruit out there that I think we can do for a lot less money and show some real progress. So I think everybody on council has the will to assist the school system in any way we can for them to be able to do their jobs with the resources that we have. And the prioritization of those needs paired with the funding that's available, and we can revisit those needs every year, if necessary, will give us a long-term strategic plan and hopefully be able to use our tax dollars to their best use as fiscally responsible as we can. We had a lot of stuff going on today. You know, so for my second council meeting, you know, I think I'm going home and take a couple of extra something. I don't want to say because I'm not sure it's all legal, but, you know, and I don't drink, so that's really a problem. But I might start. I don't drink, but.
I got an Advil with me.
It's a new day. Advil isn't strong enough. I appreciate the offer. But regardless of what transpired this evening, you know, and the discussion got kind of hot. I mean, there's no doubt about it. When we start talking about people's personal feelings and we start talking about their character, then that's the way that's usually how it ends up. So I am hoping and praying, and I am very confident, and alluding to what Councilman Johnson said, we do have a good council. I've served up here with everybody for a long time. Councilman Williams, you've been ingrained in this community for a long time. I think you're dedicated to serving, you know, your constituents the way you should, but we all have to work together. And believe me, I've had, over the 10 years that I've been on council, if I had if I had a nickel for every time I was really disappointed, then I'd probably take off a week or so, let's put it that way. But we're charged with serving our citizens. Regardless of what transpired this evening, we must get past whatever the controversy and dialogue was of this evening, and you wanted some type of resolution, we got it. Lots of times, you know, and I've spoken to everybody on council. There's one thing through this process, every single person up here knew exactly what was going on because I kept everybody informed. Yes, this was that person's opinion, that person's opinion. Did we bring forth a resolution at that time? No, we didn't, because there wasn't support for it, which I'll let you know as we were going from one to the other. The city attorney and myself took all the time we could, just listening. The city attorney and myself fully researched what the options were so we could lay those options out to council. I could try to lay the options out to you. And that's all we can do, is be forthright with our information, not do anything with any malice, as I mentioned before. I was always okay with it, you know, with not the first part, not the renewal part, but I was okay with the bidding. But that's just my opinion. And as I mentioned before, I don't think there was any malice or anything intended. Everybody is entitled to their opinion, and lots of times up here, everybody's not going to agree. Now, it is unfortunate that we got into some of the personal issues that we did, but we have to get past that so we can continue, so we can come together and continue to do the people's work. And I am confident we will do just that. So, with that being said, I'm going to go to my quote of the night before I ask for adjournment. Adjournment. Told you I needed something to drink. And that's from Tony Blair, former Prime Minister of the United Kingdom. And that quote is, I think the journey for a politician goes from wanting to please all the people all the time to a political leader that realizes in the end his responsibility is to decide. And when he decides, he divides. And with that, I'll say good evening. And then need a motion for adjournment.
So moved. Let's go.
Got a motion and a second. Would anybody else like second? And second from Councilman Ward. Madam Clerk, please call the roll.
Councilmember Fawcett?
Yes.
Councilmember Goldberg?
Yes.
Councilmember Johnson?
Yes.
Councilmember Ward?
Yes.
Councilmember Williams?
Yes.
Vice Mayor Bennett?
Yes.
Mayor Duman? Mayor Duman? Mayor
Yes.
Dooman, motion is passed 7-0.
I'm asking.